Atong dekadang nangagi ilihanon malampos tanan. Sakila kabista nga ngay pangagion barog imo sa layo. Ilihanon taga bukid, taga patag, taga baybay, nagahiusa kita. Kasigarbong mga bahandi sa kulturang kinayahan, alang sa kalampuan. Alang sa kalampuan, iliganong taga bukid, taga patag, taga baybay, nagahiusa kita. Kasigarbong sa kulturang kinayahan, alang sa kalampuan. Syudad sa ilihan, mga subay nagpasikat sa kasaysayan. Mga Kristiyano, Muslimo, gigaunon, nagkahimangatan sa mga ani. Ilihanon, taga bukid, taga patag, taga baybay, nagahiusa kita. Kasigarbong mga bahandi sa kulturang kinayahan, alang sa kalambuan.
China has identified the cause of a mysterious new virus.
Coronavirus.
More than 3 billion people in almost 70 countries and territories have been asked to stay at home.
The COVID-19 pandemic challenged the whole world. No matter one's age or nationality, it affected everyone. However, the impact of COVID-19 was not the same for all. The least advantaged sectors such as the poor, the less educated, the elderly, persons with disabilities, and indigenous peoples bore much of the brunt. The COVID-19 pandemic highlighted and exacerbated deep-seated economic, social, and political inequalities and cultural inequities. As we traverse the road to recovery, it is crucial to address these inequalities to strengthen the resilience of vulnerable and marginalized groups to future shocks and ensure that no one is left behind as we move forward from this pandemic. Thus, this September, through the observance of the Development Policy Research Month, the Philippine Institute for Development Studies, or PIDS, and its partner institutions call on our leaders and policymakers to make social justice the front and center of the post-pandemic recovery plan to accelerate the country's recovery from COVID-19 and prepare for future shocks. In the Philippines, the 1987 Constitution frames the promotion of social justice as a commitment to create equitable economic opportunities. It envisions a nation where all members of society enjoy the same basic rights, liberties, opportunities, and protection. Social justice is also the bedrock of many international declarations in which the Philippines is a signatory, such as the Charter of the United Nations, the Universal Declaration of Human Rights, the Copenhagen Declaration, and the UN Millennium Declaration. It is also enshrined in the country's development blueprints, the Philippine Development Plan or PDP, and the Ambisyon Natin 2040.
So the annual Public Policy Conference, which is the main and culminating activity of the DPRM, we encourage our policymakers, the private sector, research and academic institutions, and civil society to work together in reducing and removing the socioeconomic and political inequalities and cultural inequities that divide us. Applying social justice in our policies, plans, and programs should be premised on a holistic approach that sees the organic and functional interrelationship between and among the different sectors of society. We need to recognize that the inequalities and inequities experienced by our vulnerable and marginalized countrymen affect the whole of society, as this hamper the attainment of broad-based, inclusive, and sustainable development.
Certain areas are in dire need of reforms using a social justice perspective. Foremost is education. Policymakers and education providers must design modes of education delivery that are sensitive to the needs of learners, especially those from low-income households. Students, regardless of economic status, gender, location, disability, and ethnicity, must have access to quality education. Given the importance of information and communications technology, or ICT, in delivering education and accessing information, the digital divide must be addressed to ensure that everyone has equal access to learning opportunities and digital resources. To protect subsistence and temporary workers from sudden and extended job disruptions, there is a need to improve the design, targeting, and implementation of social protection programs. Likewise, we need a progressive budgeting process that pushes resources to people and places that need them the most. We must also ensure that our public health services are affordable and accessible, especially to vulnerable and marginalized sectors. Policy makers should bat for increased investments in health programs that directly address the needs of the population. It is time for our healthcare system to adopt a life cycle approach by making quality healthcare services affordable and accessible to all, from birth to old age. Also, we need to protect communities that often endure the damage caused by environmental destruction and climate change. We must avoid activities that harm the environment, violate human rights, and endanger the well-being of vulnerable groups, including cultural minorities. We must ensure that no infrastructure, housing, or development project jeopardizes the health, safety, and welfare of communities. Thus, assessing the potential impact of proposed projects is crucial to reduce the likelihood of unintended consequences. Lastly, we must increase the participation of the vulnerable and marginalized sectors in policy discourse and decision-making, and make sure their voices are heard. This can be done by strengthening government civil society engagements and intensifying the use of bottom-up approaches. The pursuit of social justice is not easy. It is a long and complex process. But through our united effort and shared responsibility, we can have a society where the country's resources and the fruits of economic growth are equitably shared, where everyone is living with dignity and has access to essential services, where the rights of the poor and vulnerable are upheld, and where the environment is nurtured and protected. For more details about this year's DPRM celebration, including the annual Public Policy Conference, visit the PIDS and DPRM websites and follow us on Facebook.
The world stands on the precipice of technological revolution and disruptive innovations. With such reality, a future that is complex, porous, and uncertain more than ever looms over the horizon. The Mindanao State University Iligan Institute of Technology is cognizant of its role as premier research university.
Set in a region that holds so much promise and potential, we move forward to the next 10 years and sustain the gains the previous administrations have achieved. We boldly take the journey to continue influencing the future with Vision 2032.
Our vision articulates MSU-IIT's dream of becoming an intensive research university for the holistic development of the individual and society, and reiterates our mission to provide quality education for the sustainable development of the nation and the global community.
As the world continues to dissolve borders, MSU-IIT is dedicated to contribute to sustainable development beyond its regional scope. It is for this reason that the crafting of its 10-year vision was undertaken by engaging key sectors across the university to build a holistic perspective for the strategic roadmap. The COVID-19 pandemic has magnified the social, economic, environmental, and technological divides. But it also provided an imperative context to reimagine MSU-IIT. We would like to play an active role in narrowing these divides towards a sustainable future. We will intensify our interdisciplinary education and research efforts to provide solutions to challenges posed by a volatile, uncertain, complex, and ambiguous world. We continue influencing the future by putting a premium on people's well-being. Within this Vision 2032, we manifest our 5-year development plan. We strengthen our internationalization initiatives through partnerships in research, faculty exchange, and student exchange. We also forge a stronger collaboration and partnership with industry to help improve the quality of life of more people. We believe that much good for humanity can be obtained from knowledge co-creation. MSU-IIT is determined to pursue these aspirations because we are firm in our commitment to contribute to the achievement of the National Development Agenda. In doing so, we build goodwill and trust with our fellow men and international partners with whom we share and work towards the same sustainability goals. Moreover, while the university continues to strengthen its research for disruptive technologies and sciences, MSU-IIT will remain steadfast as a custodian of Mindanao's diverse cultural knowledge and heritage through continuous academic engagements and interdisciplinary research.
Join us in our vision of influencing the future.
Syudad sa ilihan, mga subay nagpasikat sa kasaysayan, mga Kristiyano, Muslimo, gigaunon, nagkahimangatan lang sa mga ani. Ilihanon, taga-bukid, taga-patag, taga-baybay, magkahiusa kita. Pasigarbo, mga bahandi sa kulturang kinayahan, alang sa kalambuan. Kalamidad, pandemya, ug uban kalisod, walay undang maagian busa magunong, malampasan perme basta magkahiusa, protektahan kita sa atong magbalantay. Ihanon, taga-bukid, taga-patag, taga-baybay, magkahiusa kita. Pasigarbo, mga bahandi sa kulturang kinayahan, alang sa kalambuan. Kalaman kani atong dekadang nangagi, ilihanon malampos tanang, sa kila kabista nga ngay pangagion barok, himo sa layo. Ilihanon, taga-bukid, taga-patag, taga-baybay, magkahiusa kita. Pasigarbo, mga bahandi sa kulturang kinayahan, alang sa kalambuan. Alang sa kalambuan.
friends, colleagues, practitioners, and scientists of development policy research. Assalamualaikum warahmatullahi wabarakatuhu. Magandang hapon, maayong hapon sa ating lahat. This day is the 8th Mindanao Policy Research Forum. To formally begin this significant occasion, let us all invoke the mighty presence of the Almighty One with an invocation, and to be followed by the singing of the national anthem.
Grasya mo upang kami mapagmahal. Dapat na tagapagpangalaga ng kalikasan. Maluwalhati ka, Panginoon. Dakila sa lahat, O Panginoon. Napakabuti mo, kailan may hindi ka nagbabago, Panginoon.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Ar-Rahmanir-Rahim. Malik Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdinas siratal mustaqim. Siratal ladzina an'amta 'alaihim ghairil maghdubi 'alaihim waladdallin. Amin. Ya Allah, Ati ya Allah, papalad na miska ya Allah ya Rahman ya Rahim. Sa mga tao biyawa ya Allah si Pagman kay ya Allah ya Rahman ya Rahim. Ya Allah bungi ngabi ya Allah sama pia pamikiran ya Allah. Amo sarami ya Allah si ko o kawapi si ko kapagingid ya Allah pakangiginawa ya kami kay ya Allah pakapamagupa kami kay ya Allah. So kalangulawan o Pilipino ya Allah si saginga Pilipinas ya Allah. Napakanudurugong kay ya Allah sa mga mapia pamikiran ya Allah si ko kapagingid ya Allah. Ya Allah, naargang kar kami, Ya Allah, Rahman, Ya Rahim. Alhamdulillahi Rabbil Alamin.
Maluwalhati ka, Panginoon. Dakila sa lahat, O Panginoon. Napakabuti mo, kailanman hindi ka nagbabago, Panginoon.
Mga kababayan, magsitayo po tayo at bigyang galang ang pambansang awit ng Pilipinas.
September is many things. It is National Peace Consciousness Month, and it also in this month that we celebrate International Peace Day. This month, by virtue of Proclamation number 247 by Malacanang in September of 2002, we celebrate the Development Policy Research Month. This year, we are happy that the PIDS, the Philippine Institute for Development Studies, and the Mindanao Development Authority partner with Mindanao State University Iligan Institute of Technology for this 8th Mindanao Policy Research Forum bearing the theme #CloseTheGap, Accelerate Post-Pandemic Recovery in Mindanao through Social Justice. And before we begin, let us first allow me to read the house rules. Number 1, for the attendees, your microphone is muted upon entry. In case you have a question, the moderator, yours truly, by the way, I am Yasmira Moner from Mindanao State University Iligan Institute of Technology. I will be your MC and moderator for this session. Secondly, we want as much as possible for this event to be as participative as possible. Kindly ensure that you will unmute yourselves later on if you wish to participate in the open forum via live. For those who are attending the webinar via Zoom, use the Q&A box located at the lower part of the screen. Click the chat icon, type your name and affiliation, and your question, and click send. You may do this while the presentation is in progress to save time. The speakers may respond afterwards to you directly in the Q&A box, or they could just answer it live after all the presentations, and of course during the open forum. We are also live streamed via the Facebook pages of PIDS, the Minda, and MSU-IIT. For Facebook viewers, at least 2 questions from the comments section will be read by the moderator during the open forum. We will screen all the questions to ensure that they are relevant to the presentations or the webinar theme. Thank you so much. And now, to formally welcome us, allow me to first introduce our very own dynamic Chancellor of the Mindanao State University Iligan Institute of Technology. Professor Attorney Alizedney Ditucalan earned his Juris Doctor at Mindanao State University and his post-Juris Doctor degree in International Economic and Business Law at Kyushu University, Japan. He is the first Filipino long-term scholar of Japan International Cooperation Agency under the Kyushu University's Advanced Program for Legal and Judicial Human Resources, the KCCP Country-Focused Long-Term Scholarship, and as the first Filipino Young Leaders Program scholar who was admitted to the doctorate program of Kyushu University. He also received his diploma in international law and union laws at Catholic Université Leuven in Belgium. He was awarded the Outstanding MSU-IIT Alumni in 2018, Outstanding MSU-IIT CAS Alumnus in 2019, and Outstanding MSU-IIT English Department Alumnus in 2018. Prior to his appointment and election, he was the former director of the MSU Legal Division Office, former dean and assistant dean of the College of Law, and vice chancellor for academic affairs of the Mindanao State University main campus, which is in Marawi. Ladies and gentlemen, a big virtual round of applause to the fourth chancellor and the current chancellor of MSU Iligan Institute of Technology, Professor Alizedney Ditucalan. Chancellor?
Yes, thank you very much, Yas, for the kind words. Good morning from Finland, and good afternoon to all of you in my beloved country, the Philippines. Yeah, it's morning here in Finland, and it's quite cold. We're approaching winter. By the way, I have to excuse myself just to be with you. I'm here in Finland for a very important meeting. Because of the project that the university is part of, the Buka project. This is a Erasmus Plus funded program, which aims to promote equity and access to higher education in Malaysia, Indonesia, and the Philippines. And I'm here in the University of, in Tampere University of Applied Sciences because the university is the lead university implementing this program, and I'll be flying in the coming days to Dublin City also for another leg of conversations. I highlighted this because this project is somehow relevant to the conversations of our Mindanao Policy Research Forum, because this is also about equity and access. Before welcoming everyone, I would like to acknowledge and welcome to the Mindanao State University Iligan Institute of Technology, our partner institutions in this forum, the good president of Philippine Institute for Development Studies, Dr. Aniceto Orbeta Jr. I've also seen my colleague at the Board of Regents of the Mindanao State University, Ma'am Miss Amina Rasul-Bernardo, ma'am. Good morning and good afternoon. I would like also to acknowledge the Secretary of the Mindanao Development Authority, the Honorable Secretary Maria Bilin Acosta. And to all of you, good morning and good afternoon. I would like to begin by saying that we are so proud to be partner university of the Philippine Institute for Development Studies and the Mindanao Development Authority to jointly host this year's Mindanao Policy Research Forum. Indeed, Mindanao comprises 40% of the Philippines' land area. It supplies 40% of the country's food. It also holds 40% of the country's mineral reserves. That development remains slow. A region that is as rich in resources as Mindanao is a sad reality. Coming out of the pandemic, we now know the extent of the effect of the lockdown. We now have statistics pertaining to the effects of the restrictions in mobility and other health protocols. The already struggling are now struggling more. And so as a son of Mindanao, I feel honored to be part of these conversations. And this is why today I'm addressing you live all the way from Europe. The recently published book called Transfiguring Mindanao says that equally significant to successfully finding long-term sustainable solutions for Mindanao is understanding the historical, cultural, social, religious, political, and economic backdrop to the situation in the region. I have no doubt about the visions of the framework of social justice in achieving faster post-pandemic recovery, because it's worth highlighting that one of the effect of the disruptions brought about by the pandemic is actually the fact that it has even widened the gaps. And looking into recovery solutions, policy solutions, using social justice lens is, to me, the way forward. No? If we want to address the impact of pandemic by addressing the unfortunate disproportionate impact of pandemic to our citizens. And so built on the principles of equity, diversity, and supportive environment, this framework might be our best chance at recovery, economically and spiritually. And we start here today in this forum. So having said that, thank you all for your time, and I wish us all a productive conversation. Welcome to the 8th Mindanao Policy Research Forum.
Thank you very much, Chancellor, for that very warm welcome. Indeed, such a very busy Chancellor. And I forgot to mention that he is now in Finland. So equally important is the opening remarks of one of the main convener of this very significant conversation, and allow me to introduce him to everyone. Dr. Aniceto Orbeta Jr. is the current president of the Philippine Institute for Development Studies, where he has served as a senior research fellow since 1992. He is an economist interested in applied economic modeling, impact evaluation, education and labor market, social protection, demographic economics, and information and communication technologies. In addition, he has extensive experience in designing, conducting, and teaching impact evaluation of programs and policies in education, social protection, judicial reforms, community-driven development, water services, agriculture, and agriculture finance. He has written papers and served as a consultant to multilateral and bilateral institutions in these areas. Before becoming the president of the PIDS, he has served as Deputy Executive Director of the Policy Development Foundation Incorporated and the OIC and Deputy Executive Director for Policy Development and Planning for the Agricultural Credit Policy Council. He was a professorial lecturer at the UP School of Economics and a visiting researcher at the Asian Development Bank Institute. He has a PhD in economics from the UPSC and did postdoctoral studies at Harvard universities. To Dr. Aniceto Orbeta Jr. Sir?
Thank you. Mindanao State Mindanao Development Authority Chair, Secretary Maria Belen Acosta, Mindanao State University, Iligan Institute of Technology, Chancellor, Professor Alizedney, Ditucalan, Lanao del Sur Congressman Yasir Balindong, represented by Chief Political Affairs Officer Attorney Noel Tupas Champong, Philippine Center for Islam and Development President and Co-Founder Amina Rasul-Bernardo, Department of Health Center for Health Development Northern Mindanao Local Health Support Division Chief David Mendoza, Oro Chamber of Commerce and Industry Foundation Incorporated President Raymond Talimio Jr. Presenters Dr. Maria Christina Epetia of PIDS, Dr. Gernelyn Logrosa of Mapúa, Malayan Colleges of Mindanao, Dr. May-Ann Mata of University of the Philippines, Mindanao, Dr. Casper Agaton of the USTP Training Research Center, Policy Advocacy on Population and Development, and Dr. Mark Anthony Torres of the Institute for Peace and Development in Mindanao. Colleagues from government, academe, civil society, private sector, and the media, viewers from the Facebook pages of the PIDS and SERPI, and our partner institutions. To all Mindanaoans joining us this afternoon, mayong hapon sa inyong tanan, and thank you for joining us in today's 8th Mindanao Policy Research Forum, or MPRF. For those attending the MPRF for the first time, this annual forum is part of our collaboration with the Mindanao Development Authority, or MINDA, which started in 2015. It is one of the key activities of the Development Policy Research Month, or DPRM, celebration led by PIDS every September. To promote the importance of policy research in crafting evidence-based policies, plans, and programs pursuant to Malacanang Proclamation 247 signed in 2022. This forum is our 8th year of partnering with MINDA and a university in Mindanao, which this year is the Mindanao State University Iligan Institute of Technology. Each year, we coin the MPRF theme that is usually aligned with that of the DPRM. This year, we focus on the theme #CloseTheGap, accelerate post-pandemic recovery in Mindanao through social justice, to underscore the debilitating impact of COVID-19 pandemic, especially on the marginalized and vulnerable sectors. Through this theme, we urge our policymakers and leaders to make social justice a guiding principle of the country's post-pandemic recovery plan, particularly in key policy areas, namely human capital development and social protection, public health services and infrastructure, and environmental resilience. The COVID-19 pandemic's widespread socioeconomic impacts were felt across the country, including Mindanao. It was particularly difficult for areas where poverty was widespread even before the pandemic. The Bangsamoro Autonomous Region of Muslim Mindanao, or BARM, remains the poorest region in the country. It registered a poverty incidence of 29.8% in the latest Family Income and Expenditure Survey. And COVID-19 socioeconomic impact assessment for Mindanao was jointly conducted by MINDA and the United Nations Development Program. This report revealed that the harsh impacts of the pandemic on businesses and livelihoods in Mindanao, which led to job losses, food insecurity, limited access to health services, limited support for micro and small businesses, and increased domestic violence and sexual assaults. In addition, the pandemic's impact on the health service delivery discussed in the report corroborates the results of the PIDS study, which observed a sharp decline in access to essential services among the vulnerable populations. We know that the negative effects of the COVID-19 pandemic cut across the sectors, but we would like to emphasize that the magnitude of the impact was not the same for all. In fact, we need to recognize, this is the fact that we need to recognize and act on. We propose to do this by renewing our commitment to the tenets of social justice and ensuring that our policies and programs are evidence-based. With this framework, we can move forward from this pandemic with a greater confidence that our marginalized and vulnerable fellow citizens will not be left behind. Through this event, we could once again share ideas and insights and learn from one another on how to address the various socioeconomic problems that confront us, especially those at the bottom of the economic pyramid. The MPRF is an important avenue to showcase the wisdom and experience of Mindanaoans. As a native of Mindanao, I am proud of this island's group's wealth of intellectual and social capital. I want to express my sincerest thanks to MINDA for the warm partnership it has given PIDS through these years. We are also honored to partner with the Mindanao State University Iligan Institute of Technology this year. PIDS celebrated its 55th founding anniversary last Monday, September 26, and we are grateful for the warm support of all our partners in the Philippines and other parts of the world. We trust and your trust and partnership humbled us. Daghang salamat sa inyong tanan.
Salamat, President Orbeta and Junior, and of course Chancellor Ditucalan for underscoring the importance of this discourse of social justice relevant to the need to always make sure that the post-pandemic recovery must always include those very much vulnerable and marginalized in this pandemic. And of course, we are still very much in this crisis. And so now, together with the 250 plus participants, again, maraming salamat po, no? At kami po ay inyong sinamahan on behalf of the PIDS, the Mindanao Development Authority, of course, Mindanao State University, Iligan Institute of Technology, for this very important conversation. And as been mentioned by our two resource persons early on, welcoming and opening this program, that this is an important conversation and we want to make use of this space as a learning exchange for everyone. So please make use of the Q&A box to chat your questions. Before we proceed with the very exciting presentations, may we request all our presenters, discussants, and of course, to Chancellor and President Orbeta to please kindly open your camera for the photo op. Okay, Miss Thea and Miss Cams, can you do the screenshot?
Thank you, Prof. Yash. Right now, I can my view is just limited, but let's okay. So kindly turn on, Dr. David. May I ask if you're ready po? Okay. So put on your best smile. Okay. 1, 2, 3. One more smile. 1, 2, 3. 1, 2, 3. Okay. Back to you, Prof. Yash.
Okay. Thank you, Miss Thea. All right. Alam kong lahat po tayo ay very interested and eager to listen to all the presentation that is in store for us. So to begin with, before we begin, may I again remind all our plenary presenters that you are only given 20 minutes to present your discussion or your topic so that we could have enough time for the open forum. We have also a moderated discussion afterwards. So for the session 1, which is plenary presentation, allow me to first introduce the first presenter. She is a research fellow of the Philippine Institute for Development Studies. Her primary research interests are in the areas of labor, economics, and macroeconomics. Prior to joining PIDS, she was an assistant professor at the University of the Philippines School of Economics. She was also previously engaged as a consultant at the World Bank Office, Manila, Asian Development Bank, Asian Infrastructure Investment Bank, and FEU Public Policy Center. She obtained her PhD in Economics, MA in Economics, and BS in Economics from the UPSE. Ladies and gentlemen, a big round of virtual applause to Dr. Maria Christina Epetia, who will going to present about her paper entitled Close the Gap. So she will be talking about the theme itself. Close the Gap, Accelerate Post-Pandemic Recovery Through Social Justice. Dr. Tina, over to you.
Thank you very much for that generous introduction. So I'll be sharing my screen. Okay. So good afternoon, everyone. On behalf of our team, the APPC team, I'll be presenting the background and rationale behind the theme for this year's DPRM hashtag Close the Gap, Accelerate Post-Pandemic Recovery Through Social Justice. So it was initially thought that the COVID-19 pandemic could have been a great equalizer given the expansiveness of its effects, and the effects are actually cutting across sectors. We can see that everyone and anyone, regardless of their background and socioeconomic status, can potentially contract the virus. But is it really a great equalizer? Apparently not, no, because present and emerging data and studies have shown that the effects of the pandemic are hardly the same, and in actuality, quite disproportionate at the expense of disadvantaged groups. What we see is that the pandemic actually exacerbated the already long-standing inequities in society. For instance, poverty incidence among the population in the Philippines increased from 16.7% in 2018 to 18.1% in 2021, which erased the significant improvements in poverty reduction before the pandemic. Looking at the poverty incidence by region, it's in the left graph, we see that more than half of these regions showed a rise in poverty incidence. And in the right graph, you can see that in general, but the most affected are the poor, as a larger proportion of the poor had reported experiencing reduced income compared to the richer groups. Now, in the labor market, unemployment rates climbed to unprecedented levels in 2020, the first year of the pandemic, and this can be observed across all regions. Unemployment rates somehow improved in 2021, but this had not gone back yet to pre-pandemic levels. And we can see that the unemployment rates were still quite high in regions like NCR, Calabarzon, and BARM. However, the impact was more severe among the poor. We can see that a larger proportion of the poor were not able to work as usual, and only a small proportion of them were able to work from home. This means that during the height of the pandemic, the poor workers were more at risk of losing their jobs and of being infected by the COVID-19 virus. In the education front, an education crisis has already been looming in the country even before the pandemic, as 9 out of 10 Filipino children struggle to read simple text. The crisis has been worsened by the pandemic, and the impact was again more severe among the poor. We can see from the right graph that based on 2020 data, there was a much larger share of children not attending school among the poorest quintile compared to the richest quintile, and this can be observed in nearly all regions. The gap between the poorest and the richest quintiles were quite wide in almost all Mindanao regions. Health-wise, the pandemic made accessing healthcare harder, especially among the poor. In 2020, 40% of the poorest Filipinos' health needs were unmet, compared to the 16% for their richest counterparts. Also, 62% of Filipino households experienced moderate to severe food insecurity, which was felt mostly by the poor. We argue that these disparities in human capital outcomes are associated with structural drivers like income inequality, poor working, living, and learning conditions, and eroding democratic institutions and political processes that persisted even before the pandemic. Now, for one, income inequality has been a long-standing problem of the Philippines. The GD coefficient, which is a measure of income inequality, is the highest in the Philippines among the ASEAN's largest economies. There is growing empirical research that finds that income inequality is a major determinant of health rather than the GDP per capita or average income. So moreover, an equal society is important for social cohesion and economic mobility. So therefore, income inequality is linked to poor health and well-being outcomes, lower social mobility, and weak social cohesion. Disadvantaged segments of the population are also subject to precarious working conditions, poor living conditions, and inferior learning conditions. For example, informal workers have poor access, if any, to social and labor protection. They also have limited protection against work-related injuries. And then poor health outcomes like low infant survival are more prevalent in areas which do not have adequate water and sanitation facilities. Poor living conditions, like in the form of crowding and poor air quality, increase the risk of getting infectious diseases and the spread of the COVID-19 virus. Students from low-income households and marginalized groups have limited access to high-quality education, technology, and other infrastructure needed for learning. So the severe and disproportionate impacts of the COVID-19 pandemic reflect the deep-seated structural inequalities and inequities in society. So we want to emphasize that it's important to make social justice the front and center of the post-pandemic recovery plan. But what's social justice? According to Rawls, at its core, social justice is assuring the protection of equal access to liberties, rights, and opportunities, as well as taking care of the least advantaged members of society. In the Philippines, it's not a new concept. No, it's social justice is already embedded in the 1987 Constitution, and it frames the promotion of social justice as a commitment to creating equitable opportunities, reducing social, economic, and political inequalities, and removing cultural inequities. So just a short background, social justice is underpinned by 5 key pillars. So equal opportunity to access resources, voice, wherein everyone can participate in the decision-making process, diversity, such that discriminatory practices are prohibited, human rights, and equity, such that the needs of specific groups are addressed to ensure similar outcomes as the general population. In this year's DPRM, we identify 3 broad sectors where social injustice largely manifests. So public health infrastructure, education and labor, and environment. When it comes to health, large disparities in health outcomes have persisted in the Philippines. The infant mortality rates in wealthier regions like NCR and Calabarzon were similar to most upper middle income countries, while the infant mortality rate in BARM was comparable to that of the poorest countries. Infant and child mortality rates also show a large disparity across socioeconomic groups. So we can see in the right graph where mortality rates are found to be highest among the poorest groups. For instance, the infant mortality rate in the poorest quintile is higher by 5 times compared to the richest quintile. Unequal access to essential healthcare services hinders the significant improvements in health outcomes. Now, first, health facilities in the Philippines are concentrated in relatively rich local governments. Second, the number of healthcare workers, including doctors, nurses, and allied health professionals, has increased in the past decades, but most healthcare workers are concentrated in rich provinces and cities. Human resources in the health sector remain a major constraint in poor and remote provinces. Third, out-of-pocket spending is still a significant source of healthcare financing, which is widely discouraged because it limits healthcare access, especially for the poor. There is lack of incomprehensive benefit package, and it tends to be curative focused. So to achieve the social justice in health, the implementation of universal healthcare should be strengthened, and this entails genuinely expanding population coverage, expanding health benefits to include primary care, and increasing support value and financial protection. Moreover, the allocation of subsidies to local governments should be made equitable, and the social determinants of health, such as living conditions, are addressed. In terms of education, the disparities in education outcomes reveal a differential access to quality education, and these disparities have been exacerbated by the pandemic. The learning and earning losses from school closures to in-person learning or face-to-face classes are projected by existing studies to be larger for the disadvantaged students. As we can see in the right graph, existing projections show that the gap in learning and earning losses between the poorest and the richest quintile is also expected to widen as the efficacy of remote learning increases. This is because students from low-income households tend to have no or limited access to the internet, effective learning resources such as gadgets, and sufficient support for remote learning. The thing is, education is critical for ensuring access to decent work and for social mobility. So inequities in access to quality education, as well as in lifelong learning and other training, lead to differential opportunities for obtaining decent work. However, no one challenge in obtaining decent work in the Philippines is the extent of the informal sector. So the informality is prevalent in the labor market, which is usually associated with low wages and limited job security and social protection. We see informal employment had been declining in the past years, so as we can see in the graph, but there appears to be an uptick of informal employment during the pandemic. The shocks to the economy and the labor market due to the pandemic resulted in massive job losses, which severely affected individuals who do not have access to social protection, including informal workers. And then the acceleration of digitalization of work during the pandemic led to the creation of high quality jobs, but it also contributed to the growing informality of work. So in turn, this raises the concern about increasing inequality, rising informality, and widening gaps on social protection. So from a social justice perspective, quality education involves three dimensions. So first is inclusion, meaning access to quality education and opportunities for realizing learning outcomes. Second is relevance, which is connected to how meaningful learning outcomes are. And democracy, which involves participation in decisions about educational quality. So in the labor market front, the formalization of work and the expansion of social protection schemes can foster the advancement of decent work and its opportunities. Now, when it comes to environment concerns, the Philippines has always been highly exposed to disaster risks like geological, hydrometeorological, and man-induced hazards. This includes exposure to cyclones, earthquakes, volcanic eruptions, terrorism, and more recently, the COVID-19 pandemic. So globally, the Philippines is recognized as one of the countries prone to disaster risk and hazards. The Inform Risk Index, which is a risk assessment for humanitarian crises and disasters, ranked the Philippines in 2022 as the top one for vulnerability to natural disasters. And then last year, the Philippines was the fourth in the Global Risk Index. It is therefore important to strengthen community resilience, which is the core of the climate change and disaster risk reduction and management policy. So these are the thematic areas for environment. So on disaster risk and climate change, the poor and the marginalized are the most vulnerable. And unfortunately, there is limited bottom-up representation from marginalized communities in non-government sectors. There are also huge disparities when it comes to allocation of resources, in which it's the richest LGUs who are getting more resources. On the legal adjudication processes, the Philippines ranks high in terms of related deaths and environmental cases globally. And there's a lot of environmental cases that stretch for long periods of time because of the slow processes in the country's judiciary system. On ancestral domains and urban green spaces, the political structures of indigenous peoples and indigenous cultural communities and the consent processes in ancestral domains are seen to be in compromise. We also see shrinking urban green spaces that are in turn needed to combat rising heat indices and island effects. On mineral extraction and environmental justice, the welfare of indigenous peoples and host mining community is also seen to be compromised, and there is an inequitable distribution of costs and benefits from extractive industries like mining. So to achieve social justice in the environment front, first, increase investments on climate-smart and green infrastructure across sectors, including agriculture. Second, mainstream tenets of environment and climate justice in economic development blueprints. Third, empower marginalized groups and strengthen community representations in institutional decision-making platforms. Fourth, improve national and subnational planning and fiscal management for climate change and DRRM. Fifth, maintain and strengthen transparency and accountability mechanisms in development projects, including extractive industries. So this is the end of our presentation for the background paper of the APPC team. Thank you very much for listening.
Thank you very much, Dr. Epetia, for that very comprehensive presentation on the need to really champion #social justice in order for especially those vulnerable, no, yung nasa laylayan, no, na sabay-sabay na makaahon, no, sa pandemyang ito, dahil lahat tayo, no one is spared from this pandemic, and yet let's face it that we are not equal in terms of how we are able to overcome, no, the socio-economic difficulties, and that there is a significant socio-economic divide that has been amplified when the global health crisis hit the across the world, no, and across societies and cultures. Maraming salamat po, Dr. Epetia. So for those who are watching us in our FB live streaming and also in Zoom, feel free to chat, to type your questions in the Q&A chat box for the Zoom participants, and for those who are watching us via the social media pages, feel free to also chat. We have our someone taking note of those questions. Just to also remind everyone that all the presentations of our presenters have actually permitted the downloading of their presentation to the website of the PIDS. So to continue with our plenary presentation, let us move on to the next presenter, who will be there are two presenters for the second presentation, entitled From Fury to Justice, Inclusive Grassroots Innovation and Data-Driven Health Management Towards Policy Making. So Dr. Gernelyn Logrosa is the current head of the Office for Research, Development and Innovation of Mapúa Malayan Colleges, Mindanao, and is the project lead of ours RISL-MC, a DOST NICER-funded initiative for COVID-19 risk management in Mindanao. Dr. Logrosa has long been interested in the relationship between health and industry. She obtained both her bachelor's and master's degree in metallurgical engineering from the UP Diliman and her PhD in health and safety risk management, specialized in risk approach to artisanal and small-scale mining from the University of Queensland in Australia. Her expertise and passion on the integration of risk management and Philippine health and engineering systems comes from her several years of experience with mining companies and artisanal and small-scale miners through her specialist work in both cleaner technologies for UP DOST projects and the Clean Gem technology. The second co-presenting this presentation is Dr. May-Ann Mata, who is a professor at the University of the Philippines, Mindanao, and is the current program lead for UPMIN's Center for Applied Modeling, Data Analytics, and Bioinformatics for Decision Support Systems in Health, or AMBA BIDSS Health. It is a DOST partnered program identifying the patterns of disease outbreak in Mindanao for control and logistics. Dr. Mata's previous work also revolved around using math to solve health-related issues. She obtained her bachelor's degree in applied mathematics from UPMIN and her master's degree in the same discipline from the University of Washington in Seattle. After finishing her PhD in interdisciplinary studies, she worked on integrating mathematical models to guide responses to viral outbreaks in diseases such as rabies and later the COVID-19. Her passion in raising awareness for infectious diseases and experience in creating multidisciplinary approaches to solve this stems from her partnerships with various stakeholders such as universities, think tanks, and LGUs, among others. Ladies and gentlemen, Dr. May-Ann Mata and Dr. Gernelyn Logrosa.
Thank you very much for that kind introduction. Allow me to share my screen. Okay, so good afternoon, everyone. To the distinguished officials and community of the Mindanao State University, IIT, Mindanao Development Authority, and also the Philippine Institute of Development Studies, and to some of our guests and colleagues who are present here today, and even for some government representatives, thank you so much for giving us this opportunity to present at the 8th Mindanao Policy Research Forum. I am Jern, as introduced earlier, and with me is Professor Mata. I am sure that everyone would at least agree that the pandemic highlighted the gap that existed between the rich and marginalized communities. And I think the earlier presenter was able to highlight that enough in her presentation. And I think our presentation by Doc Mata would, as you would see, would clearly support this. No, we may have used a different approach, but we came up with almost a similar finding. Indeed, everyone has been affected, especially at the height of the pandemic. Hence, everyone complied to the guidelines that was being implemented, and people would say that Filipinos are on the same boat, or I know how hard it is for you. So we tried to be more emphatic, yes. But one who would temporarily stop at office work while enjoying the leisure of being in the comfort of their homes, or at least still eat more 3 times a day, may not exactly know or understand what the families of marginalized had experienced. So this is what our research project was interested in knowing. Losing the only source of income, not being able to provide at the very least food for their families. This was the great divide. So imagine if every guideline would genuinely be inclusive enough to have a real touch of reality to the masses. Imagine if the marginalized are heard more. What if we actually make sure that survival comes first and becomes the priority? So this is our recommendation on how we can possibly, or at least feasibly, take from fury to justice. This afternoon, I would like to invite your attention to re-examine the fury, which for purposes of discussion pertains to the chaos and inequalities which the pandemic caused when it comes to public health services. During the height of the dreaded coronavirus, several mishaps and challenges were unraveled from both the health sector and general public. Basic healthcare has been almost inaccessible because of 2 reasons. We found that number 1, hospitals have already reached full capacity, especially with COVID cases. And as far as we can remember, ever since the pandemic started, we have a mandate that everyone entering the hospital, whether patient or watcher, shall do a COVID-19 test. Positive individuals shall be isolated or even be transferred to a hospital that accepts COVID-19 positive patients. Another reason we found for its inaccessibility is a triage system. Common illness symptoms prevent people from being admitted to non-COVID facilities. And to be specific, colds, fevers, diarrhea, cough, these symptoms can be connected to any illness, not just COVID-19. But having just one of those might cost you of being admitted or checked. To add to this, there has been an obvious neglect to other diseases like rabies, cancer, diabetes, and other equally deadly diseases that require immediate medical attention. The whole world literally stopped because of lockdowns, and not to mention here in the Philippines, where we had a series of them, almost 2 years, the longest in the world, of only allowing working individuals to go outside. Have you remembered the time when only 1 or 2 people in the family can go outside to buy food? And that's if they're lucky enough to have money. But what about those who are relying on food reliefs? How about those in need who didn't receive ayuda? Despite the efforts of our healthcare workers, COVID-19 cases remain almost uncontrollable. Surges cause untimely responses, even to COVID-19 related emergencies, and work fatigue to our frontliners. On top of this crisis are the spread of misinformation and disinformation that enraged our Filipino people and caused fear in society. So from time to time, the limitations of activities to be done and places to go to lessened. Let's just say start or mid-2021, people can now go out and travel as long as they get tested from COVID. Online school is already available and people can opt to work from home, but have we noticed that there is still a divide even in this context, because online school should have solved the education issue for everyone. But obviously, not everyone has the luxury of having stable internet. Not everyone can afford a good setup at home. Work from home doesn't cover all employees, especially frontliners, and some people needed to risk themselves every day to travel to work, exposing themselves and their families at home to the virus. So this is something that we ask again ourselves. Is this entirely fair? Is this what we call better, or there's something more that we can do? So that made us curious. The entire Philippines, people in different backgrounds would like to do something to help. Everyone tried to help. Our policymakers and government officials created these guidelines that we needed to prevent the rise of the positive cases. Our police officers ensure safety and the implementation of these rules. And even the public went their way and expressed their care through generosity for our countrymen. But the question remains, what did we do? What did the academe do to help this country fight COVID-19 and minimize the gap between those who are able to provide and not? So as you can see in the diagram, this is a picture of one of the analysis that we did. Now, a lot of interventions shown in the bottom of this diagram have been devised and implemented by different stakeholders and policymakers to minimize the risks. So these risks are shown in the purple boxes at the mid of the slide. So the challenge now is, how do we ensure that the interventions implemented are still effective and useful even to this time? So with this in mind, we developed a method that integrates risk management tools into healthcare decision-making process to enhance the understanding and utilization of risk-based thinking in public health decision-making. And this was published in a reputable risk analysis international journal. So it was mentioned earlier during my introduction that I had a background in mining and in the engineering sector. And true enough, we were able to successfully implement this process in the organization for engineering processes. And this is what we adapted and was validated for public health services. So for the risk management process, we base it on the ISO 31000 International Standard for Risk Framework, as shown in the slide. And this process of managing the risk can be broken down into 4 stages. So risk identification is basically identifying the risk, its sources, areas of impacts, events and causes, and their potential consequences. Meanwhile, risk analysis, in which we try to understand the sources and causes of identified risk, we can also identify the positive and negative consequences. So we're not just reducing the negative consequence, we're also looking at how to optimize or maximize opportunities as a result of these events. The likelihood that those consequences can occur, and we can provide inputs to risk evaluation and decide whether these risks can be treated or not. Third stage will be the risk evaluation, where we compare risk analysis results with criteria or the risk criteria. This is where the context-specific interventions come in, because we understand that each region, for example, in BARM or in Region 11, may not have a similar set of risk criteria. So in that case, we would like to tailor fit the risk criteria to whatever is appropriate to your region or location. So to determine whether the residual risk is tolerable, this is also the criteria that we are using. So this will also tell us which risks need to be prioritized. Again, that could differ from one place to another for the treatment implementation, which leads us to, finally, the risk treatment. We try as much as we can to change the magnitude and likelihood of the consequences or the impacts, no, both positive and negative, to achieve an ideal situation. So I may say in the case of COVID-19, it is really to make it on a controllable level, no, something that can be controlled by our decision makers. So in the project that I am leading, which is Project Resilience, we are deeply motivated to implement the bottom-up approach, which is why we conducted, as you can see in the slide, series of fieldworks outside Region 11. We also did focus group discussions and key informant interviews. So this is for us to see the actual situations on the ground. In fact, we invited different stakeholders, not just limited to medical practitioners. We invited infectious disease specialists, representatives from the government, economic players, and private sectors, and asked about their perspective on what is the possible threats and consequences of an uncontrolled COVID-19 outbreak. So furthermore, the data provided by the different regions in Mindanao and hospital help us identify the risk factors that significantly affect the contractability, severity, and survivability of COVID-19 cases in Mindanao. So Resilience is joined by 3 other projects. So our project is not just one in this, to help us identify and explore the different potential sources of risks of COVID-19. So together we are part of a much bigger program called PIDS Health, which will be explained in detail by our program leader, Professor Mata.
All right. Thank you, Dr. Jern. I'm really excited to share with you about our research initiatives in the first ever Center for Applied Modeling, Data Analytics, and Bioinformatics for Decision Support Systems in Health, or what we call PIDS Health. By the way, this center is being funded under the DOST PCHRD NICER program, and this consists of 4 project components, namely Project PIPA-STOL, which deals with disease data analysis and modeling case projections or forecasting. The Resilience Project, which specializes on integrated disease risk management. The EWAS Project, which analyzes COVID-19 in wastewater to map the risk of community exposure. And Project VATAS, which assesses the vulnerability of green spaces in the city to emerging infections from wildlife virus reservoir. While it is obvious not that each project do different things, what the projects have in common is that they follow the risk management process that was explained earlier by Dr. Logrosa. So in connection with the risk management process, we started off now with risk identification. I should say that across all projects, a series of consultations, coordination meetings, and fieldwork with stakeholders and key officials were held. Our goal here is to have an inclusive gathering of information where insights are gathered from the grassroots. In this way, together, we identify the most relevant risks that each project focuses on. In terms of risk analysis, the program implemented various methodologies to analyze the different potential risks, knowing the variants of concern, for instance, and the implemented control interventions. To name a few of these methodologies, we conducted viral phylogenetic mapping, spatial hotspots, and even bow tie analysis. And for instance, just to emphasize this part or this aspect of risk management process, in Project VATAS, what they did is they conducted a biodiversity assessment and hotspot analysis in green spaces in Davao City to identify areas that are at high risk for emerging infectious diseases. Their results actually showed that 61 out of 184 barangays in Davao City are biodiversity hotspots for beta coronaviruses with a 99% confidence level. In this study, what can we do about that? Well, we can quantify the odds of having new outbreak and the likelihood for a region to be a source of new epidemic in the future. And this finding also supports policy implications related to biodiversity conservation in the region. In Project EWAS, they were able to establish the usefulness of wastewater-based epidemiology method as a cost-effective surveillance technique from their analysis of their water samples collected from the sewer pipes or creeks in barangays with moderate to high risk cases of COVID-19 transmission in Davao. SARS-CoV-2 RNA was detected in 22 samples, regardless of the presence of new cases. So this surveillance method aids in classifying the risk of COVID-19 exposure among communities with low testing capacity or no testing facility at all. For the risk evaluation aspect, the projects implemented a variety of evaluation measures to determine the significance of the identified risks. So here we highlight the result of PIPA-STOL project, wherein we started with formulating a general model that uses early pandemic monitoring data. And that model has already been published, as you can see on the slide. And this model was then modified to capture the current transmission dynamics of COVID-19 using regional reported data. And we eventually used the said model to make simulations and provide precise estimates for the rates of transmission of COVID-19, recovery rate, death rate, progression rate, and hospital utilization rate for various levels of quarantine. The model was also used to make disease forecasts per province and health districts in Mindanao region. These measurements and figures were also presented in situational reports among participating regional offices of DOH as well as provincial health offices. And the reports have supported the planning of controls to be implemented in the region. All right. Now, yeah, I've shared all these state-of-the-art methodologies, but after applying all these methods, what now? How will all these efforts reach the marginalized? How will we answer their call for social justice? Well, as researchers, our answer to this call is really simple, and it is through this Disease Watch or DIWA app. So what is DIWA app? It's a virtual planning tool and integrative platform to empower decision makers for pandemic management in Mindanao. Now, the end user of this web-based app are mainly the LGUs and health agencies, especially those officials that are decision makers. No, in fact, personnel from DOH Davao CHD and the South Cotabato Integrated Provincial Health Office have already beta tested the system. Currently, we are reaching out to other health agencies in Mindanao to include them as well in beta testing. And we foresee that this app will become a system that will be used for disease risk response. And just so you know, in less than 2 years, our center is currently providing insights covering all levels of data analytics, namely descriptive, diagnostic, predictive, and prescriptive analytics. We intend to expand this analytics tool to other diseases with the continued support of our partner agencies. Presently, there are very few statisticians, if you know that, and very few quantitative analysts in every regional health offices. But our center provides justice to these agencies by means of the DIWA tool, because this tool automatically will clean, process, and analyze the disease data. Instead of them spending much time doing the manual data analysis work, the technical personnel and the decision makers can focus on making strategic plans to control the epidemic, thereby offering a timely response to potential new surges. In addition, we aid in solving the issue on misinformation and disinformation, because we provide accurate information about the transmission dynamics of the disease. Another thing, forecasting is one of the most powerful as a feature of DIWA, and the app can be used to forecast hospitalized cases, which has implication to the preparation of hospital beds or medical equipment needed in advance. And this prevents hospital from reaching full capacity, hopefully, equating to less exhausted staff. It's not shown here, but I have to mention that our phylogenetic analysis shows that the reported cases are too low compared to the actual infectious population. The question is, who are this undetected infectious population? Probably those who do not have access to testing facilities or those who cannot afford to be tested. And I think, I have to also feature this one. This is a little bit controversial. When it comes to vaccination schedules, there has been some issues that during the first few release of the vaccines, officials would keep their preferred vaccines for themselves and for their family members. Some offices also don't know where to set up stations for vaccinations, causing people to settle for whatever vaccines they can get a hold on to, or even cause the wastage of vaccines due to expiry. So with our vaccination rollout feature in DIWA, we can give you a systematic way on how regions should set up vaccination stations, how many stations to set up, and how many vaccines should be distributed. This way, everyone will have the chance to have access to the vaccine stations. And now, I think it's my turn to turn over this talk to Dr. Gern for other features of DIWA. Dr. Gern.
Thank you, Dr. Mata. So to continue, on the screen is the regional bowtie map, which is under the risk management module. So it highlights the efforts that are being made across the different levels of governance. So this method reveals the activities done by different sectors across different regions. So it is possible to illustrate everything, all the efforts into one visualization model. Bowtie, as its definition, will tell us which interventions are useful and futile. So having a systematic identification of control interventions will then help us in preventing prolonged and unnecessary lockdowns and inadequate food reliefs. So a very good example for evidence-based policy. So I think this is the last point and the most important for me personally. COVID is deadly. We already know that, and it's something that can stop the world. It is really important for us to contain and manage it as much as we can, especially in reducing the fatalities. With the proportion of the influx of COVID-19 patients and the shortage of resources during outbreaks, how can we academicians support our medical practitioners in reducing COVID-19 related fatalities, or even, God forbid, another outbreak? So hopefully we would be more prepared this time. That's why we present to you our triaging module. This will potentially aid medical practitioners and emergency personnel in determining which patients need immediate attention based on their patient information and clinical information such as symptoms and comorbidities. So this will also help avoid the crowding in our hospitals. So this module is basically a triaging strategy using survival analysis wherein we can compute the hazard ratio of a patient, which is the chance or likelihood of the patient dying from COVID-19, and this will assist health professionals in evaluating prognosis in order to provide proper and immediate treatment. So all these through our DIWA will help Mindanao address the different social injustices brought about by this pandemic. Note that this is not a perfect system yet, and even far from perfect, but this is a big step already toward giving Mindanao a fighting chance in alleviating the furies that we are currently facing. And this is actually not just an ordinary tool. This is Mindanaoan. So DIWA is made by Mindanaoan for Mindanao. We made sure that this platform came from the grassroots of an inclusive and holistic approach to disease management, giving everyone an equal chance in participating in the policy making, which will directly affect their lives in the region, therefore giving justice to our fellow men in Mindanao. And of course, I would like to take this chance to acknowledge our researchers and personnel, because this won't be possible without them. From the beginning, they have been the ones that really pursued all the methodologies and generating the reports. And they're the ones who tirelessly reach out to possible collaborators and research partners. So let me close this by borrowing a quote from Helen Keller that we have been using since our first few presentation. So alone we can do so little, together we can do so much. So along with Professor Mata, thank you very much. Daghang salamat po.
Salamat, Dr. Gern and Dr. Mata, for that very impressive presentation. And I think everybody would agree with me that this is something that we must really invest on. Public health should be a universal human right, and no one should be left behind. And I'm so proud being a Mindanaoan because the DIWA tool is such a very powerful tool where technology is being used to, you know, to wage that social justice in a way, because COVID-19 pandemic has hit us hard, and especially for those of us here in Mindanao, where many of our poor communities are still very much struggling economically and socially. Then through this way, then we could be much more prepared in addressing this global health crisis. Maraming salamat po. And I'm sure you have lots of questions. Feel free to write them at the Q&A chat box. All the presentations, by the way, the slide presentations of that you have just listened on will be uploaded to the official website of the Philippine Institute for Development Studies. All right, so from the DIWA tool that will basically be very much important and effective in trying to make use of the smart app in preparing and addressing the COVID-19 pandemic, let's go to MSMEs. We know for a fact that marami po, no, and as had been presented comprehensively by the first presentation, na marami pong mga informal sectors and much more, marami pong nawalan ng trabaho. So how can we help in terms of generating more jobs? And so let's hear from our third presenter, and allow me to introduce him. Dr. Agaton is an associate professor at the University of the Philippines, Los Baños, and is the project lead for USTP's Training Research Center for Policy Advocacy in Population and Human Development. As an environmental and development economist, Dr. Agaton has extensive knowledge and issues such as renewable energy, environment, and sustainability. He has a bachelor's degree in chemistry from the University of the Philippines, Los Baños, and another in secondary education from Divine World College of Calapan, which is where he also got his master's in education. His focus is on renewable energy, started during his master's in international development at the International University of Japan, where he was trained in environmental policy and management. He then finished his PhD in international development studies from the Ruhr University of Bochum in Germany, focusing on renewable and nuclear energy in the Philippines. His exploration of salient issues regarding economic and environmental management impact discussions on the Philippine economy at large and anchor various efforts on sustaining the socio-economic gains of post-pandemic policies. To talk about the digital innovations in MSMEs during economic disruptions, experiences and challenges of young entrepreneurs, big virtual round of applause to Dr. Casper B. Agaton. Sir?
Let me share my screen first. Thank you, Ma'am Yas, for that heartwarming introduction. Maayong hapon sa tanan. In behalf of my co-authors and the USTP Center for Human Development, I would like to present our paper entitled Digital Innovation in MSMEs During Economic Disruptions, Experiences, and Challenges of Young Entrepreneurs. So are you familiar with these company logos? I'm sure you are. Have you ever experienced doing add to cart or online shopping with these platforms? Did the frequency of buying goods online increase in the past 5 years? In the recent decades, electronic commerce and digital or online markets are becoming more popular together with the booming of modern communication technologies. Among the identified enablers of this shift include the boom of social media like Facebook, open educational resources, crowdsourcing, and data mining, which empower entrepreneurs in reducing the barriers between invention and the creation of new ventures. Another enablers are economic disruptions, such as the recent COVID-19 pandemic, which changed the consumers' habits, as well as organizations' innovation programs, leading to accelerated digital transformation of micro, small, medium enterprises, or MSMEs, as well as large firms. Now, who among you have ever thought of selling anything in the electronic market, such as Shopee, Lazada, Alibaba, or Amazon, as an additional source of income? So what factors or market conditions or policies do you consider to make this thought a reality? So these are only some of the questions that motivated us to pursue this study on the digitalization of MSMEs during the time of pandemic. I and my co-authors from various academic institutions are thankful to the Center for Human Development of USTP, headed by Ma'am Angel Colliera, for accommodating us to do this research. And also we are thankful for this Mindanao Policy Research Forum for giving us a venue and opportunity to share our findings with the policymakers, academe, and industry partners, particularly in the greater Mindanao area. So for this presentation, I will first give you a short research background on entrepreneurship and its contribution to Philippine economy. And then the research objectives will follow. Then I will describe our research methodology, our main findings, and finally some policy implications of our research. So entrepreneurship can be defined as the creation or extraction of economic value. It is an activity of setting up a business or businesses, taking financial risks, of course, with the hope of profits in the long run. And as technology advances, firms across industries realize the importance of digital transformation to make their business sustainable, and also up to date. So digital entrepreneurship is the process of entrepreneurial creation of value using various socio-technical drivers to support the effective acquisition, processing, distribution, and consumption of digital information. So it includes various businesses function sa ating life cycle ng business. So we have sales, marketing, human resources, operations, finance, R&D, and customer support service. So in the Philippines, what is the economic contribution of entrepreneurs? So according to 2020 list of establishments report of the DTI, there are almost 1 million registered. So that does not include the unregistered businesses operating in the country, composed of 99.5% MSMEs and 0.5% large firms. These MSMEs consist of 88.77% micro enterprises, 10% small enterprises, and 0.5% medium enterprises. So among the top industry sectors include the wholesale and retail trade, motor vehicles and motorcycles, accommodation and food service activities, manufacturing, other service activities, financial and insurance activities, which accounted to about 83.77% of the total number of MSMEs establishments in the country. So before the pandemic, MSMEs generated more than 5.38 million jobs, or 62.66% of the country's total employment. So while several studies across the world have shown the impacts of COVID-19 pandemic on MSMEs, the investigation of this pertinent issue in the Philippines is limited during the time that we made this study. So it was last year between September to October 2021. Therefore, the main objective of this study is to analyze how economic disruption drive business innovations for MSMEs. So specifically, this aims to explore the lived experiences of young entrepreneurs in doing business during the pandemic, investigate the challenges of shifting businesses to digital platforms, and lastly, evaluate the implications of this research as basis for government policies. So we looked at the perception of young entrepreneurs as their role is crucial and they are considered as catalysts for innovation and economic growth. And because of their eagerness to create positive difference in the society. Furthermore, since the Philippines is considered the social media capital of the world, so it makes young entrepreneurs potential contributors to the success of the socio-economic agenda of the Philippine government for MSMEs. So for the methodology, this study described the lived experiences of our young entrepreneurs in doing online business at the time of pandemic. So we applied the qualitative method with limited number of participants to achieve depth of information rather than statistical significance. So we did online interviews, taking the precautions on the health and safety of the participants and the researchers during the pandemic. So this study performed a purposive sampling according to the following inclusion criteria. The participants must be young entrepreneur, they start a new online business during the pandemic or shift to online, and voluntary participation, and lastly, completeness of the reports. So our participants are coming all over the country, Luzon, Visayas, and of course, Mindanao area. And they are ages 15 to 50 with a median of 30. So medyo bata po yung ating mga participants. And most of them are engaged in online selling or reselling, content creation such as YouTube, social media management, online teaching, advertising, writing, editing, voiceover, and others. And for the questionnaires, we only ask 3 main questions. What are your experiences during the pandemic that made you start or engage in online business? What are the problems and challenges you experienced? And what policies should the government implement to help young entrepreneurs sustain or start a business? And to analyze the data, we employ the qualitative inductive content analysis with the following process: preparation, organization, and reporting. So let's move on to our main findings. So the research applied the main findings of our study are divided into 3 categories. First, the drivers of digital entrepreneurship. Second, the barriers or the challenges experienced by the young entrepreneurs. And lastly, recommended policies to help young entrepreneurs start their online businesses. So the drivers provided 2 interesting results. So both extrinsic and intrinsic motivations drive digital innovations during the pandemic or economic disruptions. So when we say extrinsic motivation or external motivation, it involves exhibiting a behavior or doing something, completing a task to attain some external goal or meeting some externally imposed constraint. So in this study, participants describe these constraints as yung mga community lockdowns natin during the pandemic. And also some changes in the market demand and the market conditions na naging online na mostly, as well as the sudden change in, of course, yung ating household economic status as some of us lose jobs during the pandemic. So to limit the spread of COVID-19 virus, the government imposed various community quarantine measures, including face-to-face contact and travel restrictions. And this greatly affected various societal and economic activities. So on the other hand, we have the intrinsic motivation or internal motivation, which involves doing something for its own sake as people become more creative when they feel motivated or self-motivated, primarily by the interest or enjoyment or also satisfaction, and in some cases, challenges of the work itself, and not by external pressures or inducements. And the participants or young entrepreneurs describe these factors as personal and professional motivation or professional growth as young entrepreneurs, and then the opportunity to help our Filipino citizens, particularly those severely affected by the pandemic. So yung eagerness na makatulong sa ating mga kababayan, it also helped them motivate to do online business. And personal driving forces are driven by the need to earn, of course, extra income to help the family. Some of them answered for their mental health and personal development. And despite the young age of our participants, entrepreneurs perceive the pandemic and digital entrepreneurship as venues for professional growth. Now, in terms of the challenges or barriers in digital entrepreneurship, participants describe 3 main barriers: entrepreneurship skills, digitalization of market, and business environment during the pandemic. So being new entrants in the business or in our e-commerce, young entrepreneurs lack enough entrepreneurship skills or entrepreneurial skills related to doing business, particularly our online business. utilizing IT skills, and of course, yung ating personal management skills. Another set of challenges faced by young entrepreneurs was the market conditions in the digital platform. So this include financing or yung how to start a business, digital transformation from traditional to online market, and then of course yung problems with online transactions, especially yung ating mga scammers, both from the production side and also from the consumer side. And the other legal issues related to business permit applications, and also yung copyright issues sa ating mga YouTubers and mga content creators. Moreover, the business environment during the pandemic sets another challenge for young entrepreneurs in the digital transformation of MSMEs. Among these challenges are, ayan, na-mention na kanina ng ating previous speakers, yung ating energy and the telecommunications infrastructure, as well as the community quarantine restrictions that limited the spread of the virus. So to support the needs of the participants to facilitate digital entrepreneurship, the following are the recommended actions, or these are the things that they need based on their challenges faced during the pandemic. So in terms of startup support for young entrepreneurs, participants agreed that financing is the most crucial factor in starting a business. So kung pwede daw, this include the support, for example, loans with minimal interest, subsidy during lockdowns, tax reduction or exemption for the duration of economic disruption. And young entrepreneurs also raise the concern to promote their products through online marketing to reach a wider range of customers, as well as help them to apply for business registrations. On the other hand, the government should also provide legal protection to entrepreneurs and customers from fraud and scammers. So to make new MSMEs competitive at the same time sustainable beyond economic disruptions, the government should provide programs that hone entrepreneurship skills. And the participants identified these skills also, such as yung financial, accounting, IT skills, and also yung digital entrepreneurship skills. Additionally, if possible, our academic or the academe or our school partner should offer maybe some elective courses that teach the basics of entrepreneurship. Lastly, participants recommended that the government should implement programs that promote competition of telecommunication companies to decrease the price while providing more quality internet connectivity. In addition, infrastructure that provides a more reliable source of electricity, particularly to rural areas, should be developed. So with the digitalization era, innovations in products and services are crucial in attracting new customers while retaining existing ones. However, young entrepreneurs encountered several challenges and barriers to digital innovations. The findings of this research provided several policy implications that could address these challenges and barriers and help them or help our young entrepreneurs start up online businesses during and also beyond economic disruptions or the pandemic. So first, the government must provide support for startup MSMEs in terms of financing, technical capacity, marketing, and all business registration requirements. Also, financial incentives such as tax reduction credits, grants, subsidies, and other similar instruments have been used by government to stimulate technological innovations in MSMEs, which can help firms improve their productivity. And considering the vulnerability of small, micro, small, and medium enterprises compared with large firms, so they are more vulnerable to economic shocks. And the immediate policy priority on financial support should be given at the beginning of the pandemic, although it's already almost finished. And this may address the challenges of survival in the market. And other studies also showed that the technical, financial, or soft skills, example nito yung mga networking, mentoring, problem-solving skills, or acquiring learning capabilities. And also, government support hold a significant relationship with the survival of startup MSMEs. So second po natin is that the government must provide training support for upskilling young entrepreneurs. So to improve their technical competency, kung pwede marketing also, and financial literacy. So policy should address the barriers to digital entrepreneurship through structures that build digital and entrepreneurship skills through education and training programs. And as I said earlier, maybe our educational institutions may consider, for example, cybersecurity as a crucial aspect of digital education with the use of mobile banking apps, contactless payments, and online shopping apps. So in addition, it is important to help our young entrepreneurs to build strong networks to improve their access to funds, opportunities, clients, or partners and suppliers also, mga reliable suppliers. And a public-private partnership must be encouraged to reduce these technical and financial barriers to MSMEs. And finally, with the rapid digitalization of the market, the government hopefully must fast-track the improvement of our country's IT infrastructures to accelerate the digital innovation in MSMEs. Currently, comparing the current global IT situation in the Philippines, the country's internet infrastructure lags behind among those of contemporary developing countries in Asia, which hampers the motivation of users to innovate and contribute to inclusive growth and development. On the other hand, IT infrastructure development should be complemented by promoting training programs in digital skills and information on existing technologies that could be applied to production processes and marketing channels to allow more dynamic e-commerce and increase the number of services offered on the online platform by our MSMEs. So yun lang po, and daghang salamat kayo.
Thank you so much, Dr. Agaton, for that very insightful presentation. And I think there are some key words that really struck me most, and that's the need to have inclusive business and market models that would benefit not only the mainstream businesses that we do have, but more importantly, young entrepreneurs, so that they have the access to the right financing and the technological infrastructure, bearing in mind the digital divide that the country that we have in the country, which is of course something that is no longer an option now, considering that while we are now slowly going back to our face-to-face activities in doing our work, but then COVID-19 has changed a lot in terms of how we do business. And that should, of course, be considered in terms of making sure that no one is left behind. #CloseTheGap. Maraming salamat po, Dr. Agaton. The partnership of PIDS and MINDA with the Mindanao State University Iligan Institute of Technology is through its Institute for Peace and Development in Mindanao. And our fourth and final plenary presenter is its current director. Dr. Mark Anthony J. Torres currently teaches biology at the Department of Biological Sciences, College of Sciences and Mathematics at the university. He is the director of the Institute for Peace and Development in Mindanao and has written and published hundreds of research articles on conservation biology, pest and pest management, human behavior, and public health. Along with teaching and research, he also does many extension works, particularly in peace building, youth empowerment, environmental conservation, and cultural sensitivity in development interventions. Because of his work on peace building, Dr. Torres received a plaque of recognition as Guardian of Peace and Partner in Development from the 2nd Mechanized Infantry Brigade of the Philippine Army. In 2016, he was named one of Metrobank Foundation's outstanding teachers. He also received awards and commendations in 2016 and 2017 from the Philippines House of Representatives, Senate, and Malacanang. In the same year, he was the lone recipient of the Gawad Chancellor para sa pinaka-natatanging guro sa larangan ng extension. The award came with a plaque of recognition that bears citations on the contribution of Dr. Torres to the Institute's mandate of fulfilling its social responsibility. In 2017, he received the Outstanding Iliganon, a feat that he truly treasures being a city resident. He holds the distinction as one of the few Mindanaoans conferred Outstanding Young Women title in 2017. In 2022, he was chosen as one of the Outstanding Mindanaoan because of his efforts in providing training and development opportunities for the youth in Southern Philippines. To present resilience and transformation in situations of conflict and fragility, preparing Mindanao for uncertain times, let us all welcome Dr. Mark Anthony Torres.
Thank you very much, Ma'am Yas. And good afternoon, everyone. We have heard so much about security and resilience in all aspects of life, including that of health. Now, our approach to understanding resilience is kind of very different, considering that me and my co-author, Dr. Cesar G. Di Mayo, are biologists. Now, we try to understand how biology is also able to influence all aspects of the different disciplines studying life. Now, the title of the presentation is Resilience and Transformation in Situations of Conflict and Fragility, Preparing Mindanao for Uncertain Times. I'd like to bring the discussion to what we call as, let me first, okay, so sorry. What has been discussed earlier are concepts of resilience in health. Our proposal, our recommendation is a One Health approach to resiliency with regards to health. Because as biologists, we see that the problems that we have, for example, related to COVID-19 pandemic, has something to do with the health of populations of other forms of organisms other than humans. And so what we see is very important is not only the health of populations of humans, but also health of populations of animals, whether they're birds, they're poultry, etc., wildlife, or even plants. So this is very important to us because we know that there is a transfer of health challenges from one organism to another, and this concept is what we call as zoonosis. So we now see that the human beings are not alone in terms of like being challenged with health problems, but also other forms of organisms. And so, for example, there were many assumptions with regards to how COVID-19 arose. It was there were theories that it came from other forms of organisms, including pangolins, bats, etc. But these are all because we see that there is a link between the human and all other species health. This is because of the emergence of the concept of zoonosis. So in Mindanao, our problem is not only that of the problem of producing food and also in terms of security as to the health and well-being of our people, of our population. We have also relevant conflict lines challenging our populations of humans. Now we have the Bangsamoro right to self-determination, the conflict between the government and the CPP and PNDF, resource-based conflicts, inter and intra-community conflicts, and other forms of shadow economies. Now, so these are all very important to consider when we plan for development of our populations. And we see this one as very important because there are studies wherein resiliency comes off very different when you have a population of humans in cities or municipalities that are relatively peaceful and those that are not so peaceful. In the case of Mindanao, because of these conflict lines, one of the ways to be able to address these issues is through economic interventions in the form of livelihood. And some of these interventions, livelihood interventions, are in the form of agriculture, meaning to say, to be able to revitalize local economies to address the issue of poverty, which is one of the drivers of conflict and violence. You have there agriculture interventions. We have seen how the government has put up abaca plantations in some of the interior municipalities of Lanao del Norte and Lanao del Sur, just to also address the issue of poverty, now, which is becoming one of the main drivers of conflict and violence in many parts of Mindanao. So this is where we are coming from, because now the definition of peace, security, prosperity, and resilience comes very differently when you talk about conflict-affected areas. Number one, when you talk about conflict-affected areas, you talk about the root causes of violence and conflict, which is not only limited to understanding enemy images, biases, discrimination, and stereotypes among the different people, but also the root causes of poverty, lack of access to basic services like potable water, reliable food supplies, and etc. So these are very important to consider. Now we're going to focus on the issue of supply of food, which is very important to us because, when you talk about livelihood opportunities here, the context is that most of those that are planted in our conflict-affected areas are sources not only of livelihood for the local economy, but also sources of food for our populations of people, especially the marginalized sets of populations of people. The concept here is the words adaptability, flexibility, resilience, and legality. And henceforth, our proposal, our recommendation for One Health approach, what we are saying is that the interventions coming from the government in terms of agriculture may fail in the future if we don't also look into the health of the abaca, the different value crops that are being planted in our conflict-affected areas. In many parts of the region, or in Lanao, for example, the abaca plantations, some of them have succumbed to banchita virus. So these are abaca plantations in some of the MI left camps, some of the areas that have experienced long history of protracted conflict. So what is happening here is that if this government interventions in the form of the abaca plantations would soon fail, then that would add other layers of conflict, because that would produce so much emotions in the form of frustrations on the part of the local population. So this is our proposal, the One Health approach. If we're going to look at the relationship or the nexus between climate change, environment, and conflict, it's kind of very complex, because in not all situations we're in, there's a failure with regards to food security. In fragile contexts, in some other contexts like Somalia, there were incidents when they saw that surprisingly it was able to survive the 2011 food crisis, even though it was affected by conflict and had an effective government since 1991. In other countries, like for example in Haiti, when the earthquake struck in 2010, there was massive impact that was very negative to the local economy and to the health of the population, because the earthquake came into the point of Haiti where there was so much poverty, there was so much social exclusion. So this reinforced the social injustices. Now, very difficult for people to access social services because of the conditions, the local conflicts as well. So in this graph number 1, we see how there is a relationship between food insecurity and instability. So this is where we're coming from, and we are grounding on that the instability in populations of humans now in our communities might be reinforced because of food insecurity. And this is the reason why we're proposing for One Health approach to resilience, especially with regards to health and food security, because we know that if there would be continued hunger because of, and also poverty because of failures in agricultural systems, failures in producing food, this will contribute to further instability. So this will challenge the gains of the peace processes here in Mindanao. So what we have seen so far is there is a limitation to what kind of organisms or commodities that are being used by conflict-affected areas in rehabilitating and normalizing the lives of people in conflict-affected areas. For example, in Munay, in Camp Bilal, so we see abaca, coconut, and rice. But when we see these kinds of data, we only look at very few, very limited opportunities for economic revitalization. But Dr. Dimayo and I, we saw that if, for example, the communities would just imagine how they're going to utilize their knowledge about healing and traditional medicines. We asked them during the times of crisis and wars in the past, where do they go? Because they could not go to the pharmacies. They subscribe to using local sources of medicines, like their food, their plants around them. So these are very important information that could be used to feed into commercialization of products where the local community would be able to benefit. So these are very important to us because the health of the local economy really entirely depends on the breadth and richness of the natural resources found in the area. If the people, especially, for example, the MRLF, would only be able to realize the immense diversity of natural resources that they could use for economic revitalization, then that is already a step forward towards stability and resilience. However, what we see now is that development plans are anchored on only very few natural resources, like, for example, abaca, coconut, and rice. So that's how we see what is important. So the One Health approach is something that is important to us because now, as biologists, now Dr. Dimayo and I are population biologists, where Dr. Dimayo is a geneticist. We saw that economic interventions in the form of agriculture, if not accompanied by scientific research, would fail. For example, as what was previously mentioned, the abaca plantations, if these would succumb to Banchita virus, would be the mortality rates of the seedlings would be very high. And this would add another layer of frustrations of the local people against the government. So hence would be destructive of the gains of the peace process. Now, in the case of invasive species, our studies show that the agricultural systems in parts of Mindanao, for example, in Lanao, we saw widespread invasion of species that are not native or indigenous to our localities. Now, for example, the golden apple snail or Comacea caniculata, if you look at the structure, these are results of our analysis. Dr. Demay and I are using computational biology in the form of geometric morphometrics to analyze populations of organisms and whether or not they have flexibility. Now, they have genetic diversity to be able to survive environmental perturbations. The concept in evolutionary biology, one of the assumptions that we have is that organisms are able to survive perturbations in environmental conditions once they have very high genetic diversity. So what we saw in the golden apple snail or kohol, which is the Pomaceae canaliculata, is that it is able to survive well in new environments, including that of interior parts of Lanao, so that when this attacks the agricultural systems, the interventions, the economic and livelihood interventions that the government has for the local communities of MRLF, then this would succumb, no? The agricultural systems would succumb to the attacks of Pomaceae caniculata because it's very high genetic diversity. If we're going to look at our studies as well on sources of carbohydrates and proteins, the alternative sources of carbohydrates and proteins, there seems to be limited diversity with regards to the phenotype of the organisms, which could serve as proxy indicators of the genetic diversity of our food sources. No, if, for example, no, you combine that one, the high genetic diversity and high phenotypic diversity of invasive species attacking our agricultural systems, and the very low genetic diversity of our sources of proteins and carbohydrates, then that would mean instability with regards to our food sources. Now, so what we are now really proposing is a One Health approach to food security. This is an example of the Abaca banchita virus. We have heard of narratives of Abaca planted in Camp Bilal of Munay. This is Camp Bilal is one of the largest camps. It is the largest camp of the MILF, the Moro Islamic Liberation Front in Lanao del Norte. Camp Bilal straddles between the areas of Lanao del Norte and Lanao del Sur. So one of the interventions with regards to the normalization process as part of the peace process between the Bangsamoro and the Philippine government is this Abaca. So introducing Abaca plantation to revive or to help revitalize the local economy of Munay. However, our fear is that if these populations of Abaca would succumb to banchita virus because of lack of interventions coming from the academe and the national government agency and the local government units, then this economic intervention as a form of normalization would add fury and frustrations among the people, which is not very good, no? Because we know that a part of or result or consequences of the conflicts, violent conflicts in the past, are a lot of emotions, including frustrations, mistrust against the government. So this is also the things that we see at the Institute for Peace and Development in Mindanao, that the normalization process, the economic interventions that the government used to address issues of poverty, which is the driver of conflict and violence on the ground in our communities, the economic intervention should be accompanied by pure research, accompanied by empirical data as to the health of the valuable resources of food and medicine, etc. So this is something that is very important to us. So what we are saying in our One Health approach is that when you talk about resiliency, we couldn't talk only about the health and resiliency of populations of humans. We also have to talk about the health of the bats around us, the birds around us, because if we're not going to look into the health of the birds, populations of birds around us, then you have avian flu, which could not be controlled because of zoonosis. So we have to look into the health of all species of organisms, not only humans, but also other forms of animals and plants around us. Remember that the fate of the Bangsamoro peace process and other peace processes that we have in Mindanao especially on the aspect of normalization, relies on the success of the interventions on the ground. If the economic and livelihood interventions would fail because it would succumb to diseases, both emerging and pervasive diseases, then we will have instabilities. We will have uncertain futures. So our call now with MSU-IIT is really collaborate and help with each other as to how we can come up with a sound intervention to help check on the populations and the health of the populations of organisms, not only on human species, but all the species that are around us, whether they're humans, animals, or plants. So I think MSU-IIT is that is what we're trying to do, and this is the reason why in the Institute for Peace and Development in Mindanao, we have gone to the point of recruiting people from the other disciplines. Personally, I'm a biologist. Dr. Di Maya is also a biologist. We're working on the concept of environmental peace building because we know that one of the major conflict lines in Mindanao is because of resource-based issues. There are conflicts because of competitions for scarce resources. In the future, we think that the resource that is very important for us that could become a driver to conflict and violence are natural resources that are sources of carbohydrates and proteins. So these are sources of food and those resources that are very important for healing, like the traditional sources of active metabolites that could be used for medicine. So these are the things. Now, we are thinking that when we plan for our local development plans, when we have that, when we craft them, we have to think about the future. What kinds of diseases, what kinds of health problems will be confronting our populations? What kinds of new conflict lines would also divide our people on the ground? So there is really this understanding that when we talk about conflict, it's not only conflicts between populations of humans, but also conflicts arising from the resources around us, including attacks of diseases and violent, pervasive spread of infectious diseases. So thank you very much for listening and good afternoon, everyone.
Thank you very much, Dr. Torres, for that very comprehensive presentation on how you were able to emphasize as well the need for the natural and social sciences and the health sciences to come together as we promote interdisciplinary and multidisciplinary approaches to doing research and development towards building a more inclusive, peaceful, and cohesive society. So now that's all for the plenary presentation. Let us all breathe, and I hope that just as I am overwhelmed, no, sigurado akong marami din talaga tayong dinadigest ngayon ng mga information. No, sabi nga ni Sir Mark, importante ang food security, no, especially now that the COVID-19 pandemic, no, has really reeled over, and you know, physical health is much as important as mental health, and we need to really be physically strong so that we can also be able to think smart. So maraming salamat, Sir Mark. So before we proceed with our open forum, let us hear, and I'm sure that our panel of discussants are also equally adept in sharing their insights, perspectives, and reactions to all the four presentations that we've just heard. So to start with, our first discussant is actually in lieu of Honorable Yasser Balindong, the Congressman of Lanao del Sur and the Chairman of the Committee on Mindanao Affairs, who can't make it because he is right now in the Congress for the budget hearing. So allow me to introduce his representative. Attorney Noel Champong is an active trial lawyer and a professor of law at the Manuel L. Quezon University and teaching Constitutional Law 1 and 2, Administrative Law, Law on Public Officers, Election Law, Public International Law, Private International Law, Land Titles and Deeds, Legal Writing, Legal Research, Legal Profession, and Legal Ethics, among others. He is a bar reviewer for political law. He manages the Champong and Associates Legal and Legislative Consultancy Office. Attorney Noel Topas Champong is now the Chief Political Affairs Officer of Congressman Yasser Alonto Balindong, the Chairman of the Committee on Mindanao Affairs, House of Representatives. Attorney Champong, over to you.
Yes, good afternoon. I'm sorry I cannot be seen moving because of poor connection, and my audio may go off in a moment. Anyway, my camera, both my camera and my microphone are experiencing post-pandemic recovery, so to speak. But seriously, I would like to thank you for inviting Congressman Yasser Alonto Balindong, Chairman of the Committee on Mindanao Affairs, to be one of the discussants in this 8th Mindanao Policy Forum. Much as the Honorable Congressman would like to be with us today, he has to be in the plenary hall of the House of Representatives as the General Appropriations Bill is still being deliberated and may be approved by the House either today or tomorrow. So he has sent me his Chief of Staff to be his alternate. I will try my best to reflect the Honorable Chairman's thoughts in our discussion. We are glad that Dr. Maria Tina Epetia of the Philippine Institute for Development Studies was able to gather data from different sources as bases on how to accelerate post-pandemic recovery through social justice. Under our legal system, we have a classic but long definition of social justice in the case of Calalang versus Williams, decided in 1940. But it boils down to the idea of social equilibrium and social interdependence towards achieving a greater good to the greatest number. We agree that COVID-19 did not equalize social inequity. For like a land which was not prepared for the impact of a predictable heavy rain, so is our society not properly structured to ward off a predictable pandemic. I'm not an expert in interpreting bar graphs, but looking at the bar graph of the poverty incidence among population in 2018 and 2021 in the fourth slide as presented early on, one cannot avoid but notice BARM among the rest of the regions with a more than 60% poverty incidence before COVID in 2018, but improved a lot during COVID with a little less than only 40% in 2021. This is astonishing, the opposite of what we are expecting. How come the poverty incidence even improved during the pandemic while the rest of the regions, except 4 other regions, CAR, Region 2, Region 8, and Region 9, slightly worsened? Or maybe I have a wrong interpretation of the bar graph. Correct me if I am wrong. The presentation of Gernelyn T. Logrosa and Mayan Mata entitled From Fury to Justice, Inclusive Grassroot Innovation and Data-Driven Health Management Towards Policymaking shares what they term to be mishaps, lapses, and challenges to both the health sector and the general public. With all due respect, we view the situation on the policymaker's vantage point as far as Congressman Yasser Alonto Balindong is concerned, as instead unpreparedness to disaster. For now, we call the culprit as COVID-19. But to our view, it could be any other disaster, not necessarily COVID, but some other pandemic, natural calamity, man-made calamity, or whatnot. The bottom line is that we are unprepared. We agree that basic health care must be accessible all the time so that when disaster strikes, it is already in place. The Constitution in Article 2, Section 15 declares health as a right to be protected and promoted. But what have we done so far? After 35 years from the ratification of the 1987 Constitution, we are still witnessing a valuable of power and resources with respect to healthcare. The national government is supposed to devolve health to local governments. Yet, observers say that the central government had only devolved functions, but retains much of the resources. To prevent having hospitals without funds, some legislators are planning to renationalize local hospitals. And the central government, being unsure of the sincerity of local governments to fund hospitals, may agree to the renationalization in order to retain the funds. The poor citizen is caught in the middle, and while this is taking place, disaster strikes. We hope that with the full implementation of the Mandanas ruling, whereby local governments will have more share in the national income, will prioritize health for their constituencies so that the national government can focus on national concerns. We are hoping that with the vibrant local hospitals and health units, we can already have health database for each individual, for each locality, and for the entire nation, so that we will not be caught unprepared. Of course, this should be coupled with health facilities and health infrastructures manned by competent health personnel, so that we will not be caught flat-footed. The presentation of Dr. Casper Agaton on digital innovations and MSMEs during economic disruptions, experiences and challenges of young entrepreneurs is timely. The pandemic had opened our eyes on the bloated middleman economy. I am not an economist, but I think the series of middlemen creating a wide gap between manufacturer or producer on one end and consumer on the other end has for long blown up the price value of goods and services, so that when the product reaches the customer, the same already carries a staggering price. The occasional lockdown had almost wiped out the middlemen. But the question is, did the prices of commodities go down? If we can figure out how to reduce the prices through online selling, that would be good for the consumers, and they will find social justice. But how about the middlemen? They're also part of the society that we need to survive, that need to survive. Perhaps they can re-engineer themselves after finding that their skill has become obsolete. Or we should find a place for them to be a productive part of the economy. That too is magnanimous social justice. We have observed that the major players in the digital innovations are companies like Lazada, Shopee, Alibaba, etc. These, to our knowledge, are foreign corporations taking advantage of the situation, either because we lack the imagination, the initiative, or the inspiration to handle platforms like this. Maybe we lack the support from our government to have the courage to take the lead in field exploited by foreigners in our land. Perhaps we are worried that as soon as we take the first steps towards success, our government is also preparing how to impose taxes on us. I am just thinking aloud, trying to understand why we hesitate to take the lead in digital innovations. We agree that internet connectivity should be improved and power outage should be minimized. DTI, DOE, and DITC should work hand in hand. In behalf of, I have no time anymore. I was not able to listen to properly because of poor connection to the presentation of Dr. Mark Anthony Torres, and I just have to end my discussion. In behalf of Congressman Yasser Alonto Balindong, Chairman of the Committee on Mindanao Affairs of the House of Representatives, I would like to thank you for giving this opportunity to listen and also to contribute. Again, thank you.
Attorney Champong, for that very, in a way, critical observation and the need to really traverse all those, the need to look into the nexus of all the presentations that have been made. And so reminding the rest of the discussants that we only have 10 minutes for each discussant to wrap up their their discussion. So our second speaker is actually my kind of empowered woman. Ms. Amina Rasul is the president and co-founder of the Philippine Center for Islam and Democracy and a trustee of the Magbasa Kita Foundation Incorporated and a fellow of the Strategic Studies Group of the National Defense College of the Philippines and senior research fellow of the Asian Institute of Management's Policy Center. Her experience as a peace builder is both an impressive and inspiring feat, as she was the presidential advisor on youth affairs and concurrent first chair of the National Youth Commission under the Ramos administration. She was also the commissioner of the National Commission on the Role of Filipino Women, now the Philippine Commission on Women representing Muslim women, and was the first Filipino to be invited as a senior fellow by the United States Institute for Peace in Washington, D.C. She obtained her master's degree in business management from the Asia Institute of Management and her master's in public administration from the Kennedy School of Government at Harvard University. She continues to actively work towards promoting human rights, justice, and democratic practices in Muslim Mindanao. Over to you, Ma'am Amina Rasul.
Thank you. Thank you so much, Yasmira. Okay, right down to it because I only have 10 minutes. First, the paper of Dr. Epetia. I think the Chief of Staff of Congressman Balindong had made mention to the statistics. The report of the Philippine Statistics Authority 2021 noted that the poverty incidence among the population may have increased to 23.7% during the first half of 2021, but it also notes that there were 5 regions that did a little better, and that included BARM. It says that BARM saw the largest poverty reduction of 17.4 percentage points, possibly also reflecting the progress made on the peace process. But it also talks about the fact that there were less severe restrictions, less lockdowns in BARM and in the other areas. Now, at the national level, that has been really hot debate in the years of the height of the pandemic, talking about lockdown versus the economy. And I'm just happy that the government's program, which actually we should thank the private sector for, was able to more efficiently distribute vaccines, which allowed for easing up of the restrictions in NCR. But we should be looking at the developments in BARM and really find out why it did better than regions 8, 9, 11, and the Cordilleras in reducing poverty levels, because this is unexpected by many. I would also like to note that if we're looking at social justice, if we're looking at job creation, improving individual and family incomes, especially in Muslim Mindanao, that we should be really at this point in time be serious about reducing the levels of adult illiteracy. 1/3 of the adults in Muslim Mindanao are illiterate, zero literacy, no read, no write. And if you have that many in the labor force who are illiterate, 2/3 are not going to be college graduates. So you're probably saying 2/3 of the adults in BARM would have education levels of maybe 3rd grade, 4th grade, and below. Why have we not done anything about this over the decades of the existence of the Department of Education? The focus of DepEd is, of course, on children. But when it comes to adults, there really isn't an integrated systemic program that addresses the reduction of the literacy levels. Now, if you're in BARM and you have a peace process going on, if there's going to be really increased investments and business developments in BARM, where do you think the skilled labor is going to come from? It's going to come from outside BARM. And I ask you, is that going to remove the stress on potential conflicts, or do you think it would increase conflicts if those who will benefit from the peace process are outsiders and not those who are citizens of BARM? Now, with regards to the health data, Dr. Logrosa's paper, I was just wondering about the source, for instance, of the data, because right now you have big data that's available to analyze trends, analyze problems, so you can better deal with it. And I would just like to bring to the attention of MINDA, PIDS, and MSU-IIT an interesting project which has become a corporate entity that my eldest son, Ibrahim, has been part of. They had this weird idea that the sari-sari store would be, or is rather, a vital source in the economic chain, because you've got a sari-sari store, maybe 2, 3 in the same area. Can you get data from them? Can you provide financial literacy to them? So I suggest that you take a look at their website. Look for Packworks, PACKWORKS.io, I think. What they did was to develop a mobile app that sari-sari store owners can use, and this provides them financial literacy. It allows them to manage not just their finances, but manage their inventory. And it provides Packworks with the ability to look at data, big data, and make the analysis. For instance, they found out that after the Taal eruption, after the Abra earthquake, after Typhoon Odette, when they looked at the data of sari-sari stores, guess what was the #1 sale item? Wasn't food. It was hair care products. It's something that we should be looking at. I mean, what are the habits of communities? The second question is, you've got sari-sari stores all over the place. Why can they not be developed into, say, the source of medicine for simple ailments? Why can't the generica pharmacies be coupled, be linked with sari-sari stores? This will now provide you more social justice because it makes access to medicine a little bit easier. Plus, it provides your micro-entrepreneurs, the sari-sari stores, with additional income. Let me just say that Packworks has been so successful that it was able to get $2 million in their first round of a call for investments among angel investors. And the investors have included the Asian Development Bank. So do take a look at it, if because I think sari-sari stores, if properly organized, can actually be a fantastic source of big data for whatever analysis you would want to do, especially about developments at the community level. Now, this also brings me to a suggestion to our congressman that perhaps we should be taking a look at greater support, investment support in micro enterprises and cottage enterprises. If you're looking at SMEs, how many are there in BARM? You can probably count them on your fingers and toes. But there are thousands and thousands of micro enterprises, and who's taking care of them? Who is providing them credit? Hardly anybody. They can't access the banks. So maybe we should be taking a look at how do you provide investments for the micro? How do you actually invest in the sari-sari store, which at the end of the day is also the source of financing in the communities? The padala system uses many sari-sari stores. So why don't we take a look at that? Social justice with health. Many years ago, the Development Academy of the Philippines had developed a barefoot doctors program, looking at how you can give training to the local herbolarios, for instance, or the hilot, so that they could be the first line of defense when it comes to diagnosis. Whatever it is that they could not analyze, then they ship them off to the hospital or the nearest clinic. Perhaps we should take a look at this, because certainly in BARM, you don't have and you will never have enough nurses, and you will never have enough doctors. So I will end at this point because I think I may have exceeded my time limit. Thank you.
Much, Ma'am Amina, Regent Amina Rasul-Bernardo, for that very forward-looking, and I think there's a lot of policy recommendations there, which could be really, be a source of concrete action steps towards the post-pandemic recovery that is anchored in social justice. And let's move on to the third discussant, Dr. David A. Mendoza. He is the Chief Local Health Support Officer of the DOH Center for Health Development of Northern Mindanao, a former municipal health officer, a field epidemiologist, and a health humanitarian responder. Dr. David A. Mendoza. Over to you, sir.
Yes, Mom. Thank you for this opportunity to be part of this forum. And, it really made me awaken, or it awakens me for all the problems that you have. As a municipal health officer before, I was taught that doing the job in the community is the best. It was really a great challenge for us in the health sector. And even now, still, we're talking of health injustice. We are talking about social determinants in health, which is the primary reason why our health system still, until now, is at the very low utilization. Based on the talks given to us this afternoon, I would like to discuss further the unequal access to essential healthcare service hinder its improvement in the health outcomes. Yes, it is true. However, I would just like to know from the discussant that according to her, health service delivery, health facilities are limited and concentrated in relatively rich local government unit. Our health facilities are not limited and not concentrated. And in fact, part of our program in the Department of Health is to build capacity local government units to have their own health system, just specifically for the universal health care. We are building barangay health stations, not in rich local government units, but even into the farthest part of the barangay, because those are the priorities. We understand that there is inequality, there is less services among the poor, and that is why we have to focus. Our services now is focused on the marginal and low income areas. Healthcare workers are concentrated in relatively rich local government unit. Yes, it is true, and not really, not all health workers, but rather most of our specialists are really found in big cities rather than go to the mountains or the far-flung areas. And lastly, there is a high level of out-of-pocket when it comes to hospitalization. That is why with the universal healthcare, we are now focused on the preventive aspect. When we prevent the disease, there will be less hospitalization and less out-of-pocket. And this is where the health financing scheme in the universal healthcare will come. And also, this will be part and parcel of what the mandate of the PhilHealth that they should do. There are areas in the region, especially here in Region 10, that they have really improved health system because there is a good collaboration among local government unit. And to think, we were thinking of universal healthcare, a health district system. We have done that before already, prior to the devolution. That is what we call as integrated health system in every area. And that was very, very successful. However, there were changes when the administration changed. There were also some changes. Okay. When we talk about the pandemic, yes, we were really caught off guard. Why? Basically, we are not ready. During a good example is we have different kinds of disasters. As discussed earlier, we have the humanitarian, we have the what we call these diseases, we have the typhoons and other events. It has been the mandate with the Department of Health to instill in the local government unit the disaster risk reduction and management plan for health. And actually until now, less than 10% of the local government unit have their plans on disaster management. When we talk of disaster management, it does not just talk about the floods, typhoons and all. We included the biological aspect or the epidemics. And that is where we lack. In fact, in our region, for Region 10 actually, of the 5 provinces and 2 highly urbanized cities, we only have, all of them have already their own DRRM plans, but the enforcement or the, what you call this, how they implement is still at the young stage pa, no? So it's really a challenge according to Dr. Logrosa, no? When we work alone, we do little. That is true. That is how, that should be what we should do in the universal healthcare. We will work together to have a better understanding of our surrounding, the health systems and the health of the people. When we work together, we do much. Just like what we did in the pandemic, kung kailan tayo nagkaisa para labanan ang COVID-19, we were able to do it. Now, our problem is, again, kaya nang nasabi kanina about the vaccination. Until now, we were not able to reach 90% of the vaccination among our communities, especially among the highly vulnerable population, the senior citizens. We are still at 70%. In fact, the president has given us a target of 90% of all the senior citizens to be given at least a minimum of 2 series plus booster, and 50% among the general population to receive the booster. But until now, we are still at 20%. And those are the things that we have also to consider. It has, we were doing our best, not only the Department of Health, but everyone, even the local government unit, the academies, the media, and all of the stakeholders. But still, there is still a lack of understanding in our health system, especially among our vulnerable populations. So For other entrepreneurship, no, I have seen that yes, we do have to improve. Our health system is still going down, but at the later stage, we are improving. The delivery of the health services, we are hoping, but with the implementation of the Mandanas ruling, wherein sana all the local government unit will take focus on the health. Kasi based on the Mandanas, it was not stated that this percentage should be given for the health sector. And we're hoping that all the local government unit to do that para there will be equity among our communities. So with that, no, I would rather thank the organizer. I was impressed by Ma'am Amina, attorney, the one representing the congressman. Their thoughts are really like all of us have to think twice, many times for the improvement of the health of our communities. Mayang hapon ug daghang salamat.
Salamat, Dr. Mendoza, for that very reflexive discussion on really the need to be proactive, but at the same time, aggressive in the campaign for vaccination that would really benefit, especially those communities who are vulnerable to human-induced disasters and much more, of course, when you look at the nexus of climate change, environment, and these existing diseases right now. Daghang salamat muli, no? And finally, we have our final discussant, who is the president of Oro Chamber, Mr. Raymond Talimio Jr. It has over 30 years of experience in the practice of profession, having started as staff auditor of SGV and Corporation Internal Audit Manager of Mindanao Development Bank, Director of Syntactics Incorporated, and Managing Partner of TCT and Associates of CPAs. He is also a real estate broker and ranked 6th in the exams. He served as PICPA Chapter President in 2003, Chairman of the PICPA 58th Annual National Convention in the following year, and serves as PICPA's Regional Director from 2014 to 2016. He has also been the trustee of the foundation of PICPA and chairman of the organization International Affairs Committee in 2016 and 2017. Again, a virtual round of applause to Mr. Raymond Talimio Jr. Sir?
Thank you very much, Assistant Professor Yas. Dr. Agaton, for hitting the nail right on the head. Your comprehensive presentation is very interesting, as well as the other presentations earlier. One benefit that the pandemic brought to the world, particularly to the Philippines, is the acceleration of the connectivity of our country. Although much is still to be desired at this point, we are already enjoying a relatively strong and quick internet connection, hence making electronic transactions easier and faster. Support to the MSMEs should not be relegated to the government alone. In Region 10, particularly in Cagayan de Oro City, for instance, much of the support to the startups is done by the tripartite efforts of the government, the academe, and the industry. The objectives of these three sectors are aligned such that we are focused in achieving the goals of accelerating the growth of MSMEs within the region. The support from the government should be clearly identified like the following. First, exemption from business registration fees and income tax holiday for the first 5 years, just like the fiscal incentives given to new domestic investors and foreign direct investors. A similar package should also be crafted for the MSMEs as a matter of policy. Why? MSMEs are the backbone of our economy. During the first year of the pandemic, not only did the MSMEs grow, but the existing ones supported our economy and kept it afloat for the next 2 years. It is for this reason that government should refocus its attention to giving more incentives and support to this sector of our economy. Second, easier access to capital with a scheme similar to venture capital to be managed by the government, academe, and industry coordinating council. We recognize that we have a lot of financial institutions that cater to MSMEs, including the Small Business Corporation of the DTI. The SB Corp is an attached agency and financing arm of the Department of Trade and Industry, mandated to provide financing initiatives for MSMEs. However, again, based on actual experiences, accessing these funds from these financial institutions is prohibitive due to the stringent requirements akin to the commercial and international banks. If such scheme will continue for the next 6 years, only a few will be able to fully benefit from it. Hence, the vicious cycle remains. That is, they remain as micro, small, and medium enterprises. The primordial concern of the above recommendation is to help these MSMEs level up at least one notch higher in the next 6 years. Third, acceleration program that will assist MSMEs achieve the exporter status within 10 years from its creation. Although MSMEs have contributed 15% of the country's export revenues, there is a need for government to push it higher to achieve a positive balance of payments. We cannot totally rely on the remittances of the overseas Filipino workers in the gross national product of our country, but we should maximize the potential of MSMEs as exporters. In the process, we can start healing. We can start the healing of Filipino families when OFWs start coming home and instead become entrepreneurs themselves and eventually exporter of domestic products. Currently, we at Oro Chamber, together with DTI and Easy Fulfill, a successful startup that helps fulfill requirements of MSMEs for acceleration, are working on the introduction of 15 MSMEs to Amazon and eBay. We assisted them and list their products to Amazon and eBay, and we hope that in the next 60 days, they will already ship their first batch of exports. And finally, amend the Barangay Micro-Business Enterprise Law to tailor fit all other support to be provided to the MSMEs. In essence, we need an amended law or a new law that will address the concerns raised above. On the top of Dr. Mark Anthony Torres, I am interested to know how this forum will address the concern of achieving the objectives of the Bangsamoro Organic Law, particularly on the decommissioning of over 40,000 MILF members when the 2023 National Expenditure Program has its budget slashed by DBM, hence making this component unfunded for next year. In the meantime, that these MILF members are not yet integrated in the mainstream environment, the possibility of them being recruited by other rebel groups will make peace in Mindanao unstable. I hope that the Mindanao Bloc, especially those who will be in the Bicameral Conference Committee, will ensure the slashed budget of both the BARM and the Office of the Presidential Advisor for Peace, Reconciliation, and Unity will be restored. Very quickly, let me also give a few comments on the two other talks. On the question, is COVID-19 the great equalizer? My view is yes, to some extent, notwithstanding the presentation made by Dr. Epetia. What exactly is my point? The COVID-19 virus did not discriminate the status of its victims. The inequity or the injustice was highlighted in terms of access to the then newly introduced anti-COVID-19 medicines, choice or availability of hospitals, and of course, the availability of funds to provide for expenses after hospital admission. Then the adequacy of the coverage of PhilHealth insurance became an issue when the alleged abuses of the hospitals in the PhilHealth claims, as well as the alleged favors given by PhilHealth in the reimbursement of claims was proliferating. On the second talk, when COVID-19 pandemic was officially announced by World Health Organization on March 12, 2020, no country claimed mastery in handling it. For this reason, so many countries succumbed to the ill effects of the pandemic. When the universal health care was enacted into law last February 2019, it was not immediately put to good use during the pandemic for so many reasons. Now, as the Congress deliberates on the 2023 National Expenditure Program, the DOH budget was again slashed, and that means less funds for the healthcare system. With the limited funds for 2023, DOH under the Universal Health Care should refocus its trajectory in providing support to the barangay health centers. Instead of just providing the usual medicines available to the health centers, the profile of the grassroots should be given preventive care rather than the usual curative care. In so doing, the medicines that will be provided to the health centers are based on the needs of the people, actual needs of the people, as supported by the database that each barangay has. Unless DOH pursue this path, health management at the grassroots level will not be completely achieved. Thank you and good afternoon, everyone.
Very much, Mr. Talinio Jr., for that very comprehensive discussion. I felt like I was listening to another exciting talk, no? And so that was really a kind of a very great synthesis, in fact, that you did. Maraming salamat po. Before we proceed, allow me to plug what has been shared by Miss Amina Rasul-Bernardo. Kindly listen to She Talks piece. It's available on Google, Spotify, Apple Podcast. Ayan, doon po sa mga mahilig ng audio, and like me, I'm a podcaster, so I would love to, like, whenever I'm relaxing, you could just listen to it. So various topics on women empowerment, gender equality, and of course, social inclusion. All right, so time check, medyo sobrang exciting. Again, no, please help me in providing like this platform for a virtual round of applause, and a million thanks to those who stayed up to this hour, and maraming salamat. Also, acknowledging yung co-author ni Dr. Mark Anthony Torres, Dr. Cesar De Mayo. All right, so so that we could let's be smart and strategic in responding to the questions that have been addressed to our presenters. All of them are equally important. We acknowledge that. But due to time constraint, we would now ask the presenters, those who would like to respond to the questions and the discussants' reactions. Perhaps it's now the time for you to wrap up your thoughts on it, and you could also already address those common questions that were already addressed to you via the Q&A chat box. So who would like to start? Maybe we could ask Dr. Epetia to address the first. Okay. Thank you.
So it was a really wonderful discussion, getting these details about what's the story behind the numbers, that the statistics. So it's really nice to see the point of view of the people on the ground. So having said that, it's always important to really, I agree that it's important to empower the local government units, that since they are the ones who have that knowledge on what's really going on in their community. So better cooperation and increased participation of the LGUs when it comes to the decision-making process will really be helpful in addressing these disparities across regions and in Mindanao and in this Livestock. And then we must not also forget that there are also other sectors, non-government sectors who play a role. We add our private-public sector complementarity, that the community-based groups that can help develop, especially the far-flung provinces that are not easily reached by different government services. So I agree that all of us play a role in when recovering from the pandemic. It's really strengthening, empowering, giving voice to different sectors in the community that will enable us to have a more equitable outcomes for all the Filipinos. So thank you.
For underscoring the need to really look at the systemic and holistic approaches, because indeed we are all in this together. Any other? Okay, let's hear now from Dr. Mata and Dr. Jern.
Go ahead, Dr. Sige. Thank you very much. Yes, I found the discussion really very engaging, no? And the discussions were able to touch on very important points. But I was able to capture earlier what Attorney Tupas was indicating regarding the presentation, highlighting on the mishaps and challenges, no, from certain stakeholder groups. In essence, what we really tried to convey in the presentation was really to help the role of the academe in helping the different pillars and stakeholder groups of our society in terms of making us better prepared for things like this. Because if there's one thing that the pandemic exposed, it's really our unpreparedness of our healthcare system. No, and we are aware naman of the lives of the frontliners, the doctors and nurses who were, kasi it was an unknown enemy eh. COVID at that time was an unknown enemy. And sadly, a lot of experts were really, there's anecdotal evidence that this might not be the last infectious disease problem that we will have to face. Yes. Unfortunately, we hope it's not as big as COVID, but certainly another outbreak that can start anywhere from the globe is just impending at any time. And as a developing country, we want to be more prepared. And especially as people from Mindanao, from the South, we no longer want to be dependent on the centralized system. In Luzon, it has some value, but at the same time, we have experts, we have capacity, we have tools here in Mindanao we can access. All we have to do is really work together, be aware about these tools and technologies, and then strengthen the partnerships between academe, government, and industry. No, even extend that to our civil society organization. We have heard about the pentahelix framework of really involving different stakeholder groups. So in essence, it's really capturing the lessons learned from the pandemic and making us more prepared for any infectious disease in the future through a technology, through an app. No, so if we can consolidate all that and bring that through this app, I think at least we have done a part of what we ought to do. And then I also would like to appreciate that Miss Amina Rasul was able to recognize the enormous big data that we worked on sa project po namin. That's really true. It's been almost 2 years since the project started, and we're still ongoing. And we've been working with the different regions, the different 6 regions in Mindanao. So of course, we have Region 11, those who have been responsive to us so far po, Region 11, Region 10, and Region 9. So we're still waiting and we're hoping. I think a lot of BARM people are here. So we want to extend that invitation to you po, Region 12 and Region 13, that we can really, especially po we're working together with DOH po kasi ngayon, and the regional epidemiological surveillance units. They're the source of our data actually, because what this project, this initiative started out of a request from DOH Regional 11 to help them with their data analysis. Doon po nagsimula itong lahat ng research namin. So we would like to extend that. We have Dr. Mendoza here po. So Doc, if you need to discuss this further with us, we will be happy to accommodate that po. So yun, and this big data, it's a work in progress we've been doing with DOH. So we're not doing anything that's outside of their scrutiny and their guidelines. So we are confident that having them on our side, also with the Epidemiological Bureau, working with us, we are quite confident that we're moving in the right direction. So I think I can pass on the floor to my co-author, co-presenter, Doc Mata.
Yeah, actually, parang pinakyaw na lahat ni Doc Gern. But I just would like to emphasize the importance of using data to our own advantage. Kasi marami masyado tayong data. We have lots of disease data, but the thing is, we have very, very few people who can make use of that data, analyze the data, process those data. And then another problem is yung coordination, coordination with all these offices and all the bureaucratic system. You have to sign yung mga data sharing agreement. That will really take a lot of time. So I really appreciate that Dr. sort of touched all the points that I also need to share through this platform. But I think I'm also speaking on behalf of quantitative analysts, especially those who are working in regional health offices, na sana naman mabigyan rin ng hustisya yung kanilang trabaho, na they are not just doing things like just encoding or things like that and doing analysis at a fast pace. And if you really come to think of it, hindi naman talaga nila magawa lahat ng analysis, knowing that they are limited with resources and they're also in a hurry. So as for us in the academe, we are really always willing to extend help. And through this DIWA app, ito yung pinaka-simpleng naisip namin at this point that can hasten yung data processing nila, mga analysis, and then again, using the data to our own advantage. Another thing that I have to point out is that we have lots of analysis, because this is an interdisciplinary team, by the way. We are a team of computer scientists, biologists, virologists, wildlife ecologists, statisticians, mathematicians. And in this team, we study different things, as you can see in the presentation earlier. But marami rin kaming mga policy recommendations that we generated. And there was this very interesting question. I think I'd like to point that out from Sir Ferdy. He asked whether the team have a series of recommendations for the policymakers, and I answered his question partially, but I also like to share here through this platform na isa sa mga findings namin is yung, if you remember, yung prolonged community quarantine, whether is that advisable or not, and we found out that it's not really that advisable. So marami kaming mga recommendations sa ngayon that we are collating and preparing for a policy paper, because we want to ensure that all our results are published and peer reviewed, validated. Although I shared a little some of those results here, but those are the things that we can produce in the center. And as what Dr. Logrosa mentioned earlier, it's very, very important to really work together. Kaya we're very grateful here to be invited in this forum. Hopefully, we can cascade some of our published results to generate policies from that. So maraming salamat po.
Much, Doc Mata and Doc Jer. Now let's move on to the Associate Professor from UP Los Baños, Dr. Agaton.
Hello po, good afternoon again. And we would like to thank po Minda and the PIDS for allowing us to share our research and policy recommendations in this venue po. And first, we are glad to hear po the projects mentioned by Mr. Talinio on Region 10 and about the support for our MSMEs during the pandemic. And we are sure that not only in Region 10 but also in other regions in Mindanao, there are projects that helped our MSMEs during the pandemic period. And we agreed that the policy recommendation should not only focus on government actions as mentioned by Sir, but also the concerted efforts and the cooperation between, of course, the government, and then we have our academic partners from the universities, and of course, we have the industry partners and also our civil society. And we also agree to Congressman Balindong, I think, that most of our e-commerce platforms like Lazada or Shopee or Alibaba and Amazon are all foreign. So we think that it's time for us to develop our own platform that will cater our own goods and products and also our MSMEs. Could be hopefully that will come from Mindanao. And as a final word po, digitalization of market is the future, and the future begins now, so especially during this pandemic period. And we should take this opportunity to be the front runners of this innovation in MSMEs while helping our young entrepreneurs start their businesses and also our country's economic recovery from the pandemic. Yun lang po again na thank you and have a good day.
Thank you, Doc Casper. Doc Mark?
Yes, thank you very much, Ma'am. Yes. As to, for example, the early warning, early response mechanisms with regards to the health of populations of species, not only of humans, but all the organisms around us, whether it's plants or animals, that's very important. This really needs a cooperation between the local government units, other stakeholders, and particularly the academe, because you have the human resources to be able to accompany these kinds of interventions. However, we see also because of the Mandana's ruling in the future, maybe this could be integrated into the local development plans, because we really need to look into early warning, early response mechanisms, considering what happened to the COVID-19 pandemic, where there is zoonosis and there is a spread of disease from other forms of organisms to human beings. So that should be also there present, but of course, such technical expertise could only be provided as well with other stakeholders, particularly the academe. The absorptive capacity of local government units to be able to craft their own local development plans, including these early warning, early response mechanisms, may not be there for now. And I think this is the reason why we're advocating for this. Now, while local government units are producing or coming up with their devolution transition plan, to be able to recognize such importance. Sir Talimio, sir, I've also been, Ma'am Yas and I have been working with the MLF communities, particularly those of Bico Barm or Bangsamoro communities outside of Barm. And we see the need for us to be able to integrate the aspirations and needs of our Bangsamoro communities, particularly in the 6 municipalities of Llano del Norte, into the local development plans, the BLGU, which is very important considering that the funds for decommissioning might be stalled in the coming months or years. So that is very important. However, coming on the aspect of transitional justice and normalization, a lot of it could be done on a multi-stakeholder approach. I'm banking on, for example, cooperation between the local government units and people from the academe and other stakeholders to be able to contribute to, for example, this livelihood interventions. The thing that we see now is the academe. Now, people from the academe should help look into what kinds of interventions are being provided to communities or have been provided to MILF communities, considering that we see monitoring as one of the accompanying mechanisms of the academe to these communities. No? In my experience, and Ma'am Yas was able to also, I think, see this one, Banchita virus is already spreading in the abac plantations that have been provided as interventions to MILF communities. And if no interventions will be provided to stop the spread of the virus, then the normalization process, the livelihood, the economic interventions would fail. And this would really add to another layer of frustrations amongst our people. So this is something that is very important to us. So I think that's all, Ma'am Yas. Thank you very much.
So much, Doc Mark. All right, we actually have generated like a lot of questions. That only means that all of your presentations were really found to be, and indeed there's no denying that it's very much timely, relevant, and resonate. No, it resonates to all sectors regardless of socioeconomic background, gender, religion, ethnicity, because talking about the pandemic and its impact to the society is something that we all have to really address in a very holistic manner. And I think that's why we're having this policy forum now. So due to lack of time, I'm sure that our speakers also who are still here and the 100+ participants who are still with us today would be very much happy to hear the answers. But I don't know if it's all right if we could ask the our presenters that since your presentation will be uploaded later, if you could actually give like a contact detail to continue the collaboration, ideation, the need to explore networks, because we are, I think, part of the objective, the primary objective of this policy forum is to draw lessons from the researches that you just have presented and to continue the partnership with all sectors, of course, both the government, the private sector, the CSOs and NGOs, and even the INGOs, the donor agencies that would going to fund projects that is high impact, and it would also benefit as much people as possible, and it's also community driven. So you could visit the PIDS website if you want to, because there are a lot of interesting questions about PIDS. And so before we will going to have further announcements for that, I would like to call on Director Joey Resimilia, the Director of the Policy Planning and Project Development Office, the Mindanao Development Authority, for his closing remarks on behalf of Secretary Acosta.
Thank you very much, ma'am. Maayong hapon sa tanan. Good afternoon. My warmest greetings to our partners in today's endeavor. The respective heads, Dr. Aniceto Orbeta, the President of the Philippine Institute for Development Studies, Dr. Alizedney, Ditucalan, Chancellor of Mindanao State University, Iligan Institute of Technology, our STEM resource person, Dr. Maria Christina Epetia of PIDS, Dr. Gernelyn Logrosa of Malayan Colleges, Dr. Mayan Mata of UP Mindanao, Dr. Casper Agaton of STP, and Dr. Mark Anthony Torres of MSU-IIT. And of course, to our discussants, Attorney Noel Campion, Ms. Amina Rasul of the Philippine Center for Islam Democracy, Director Dave Mendoza of the Department of Health, Region 10, Mr. Raymond Talumeo of Oro Chamber, and the remaining participants who are still around, 100+. Mayang hapon sa tanan. Many think the pandemic is gone, but it's still here. and its lasting effects continue to affect Mindanao in various degrees. I think everyone, especially those who dedicated their time to finding out what exactly these varying degrees of impact are, although the recent years have affected all of us. It is our brothers and sisters in the hemlines of society that continue to bear the brunt of the quagmire that is pandemic. We are reminded of the importance of social justice in rectifying the gaps left in areas such as the safety of our workers, the education of our children, the delivery of our health services, and the conservation of our environment in these anxious yet hopeful times. Despite the challenges presented by the pandemic, Minda participates in the uplifting of Mindanao through key strategic engagement aligned with the national policy agenda of recovering from the effects of COVID-19, otherwise known as the Mindanao Policy Agenda. These pivotal actions include the protection of people's well-being by implementing Mindanao-wide peace and development projects, the security of jobs, local industries by facilitating trade and investment projects, and ensuring the existence of enabling conditions such as vital infrastructure for connectivity for Mindanao to attract further investment and regain its lost footing. In the same spirit of social justice being heralded here today, we are all called to take part in closing the gap left by the pandemic, as highlighted by our different resource speakers and discussants earlier on. The usual mindset to have a one-size-fits-all solution should not be the case here in Mindanao. Context-specific approaches must be considered. Highlighted in today's forum are the inclusive grassroots innovation and data-driven health management, digital entrepreneurship to address dramatically shifting businesses into digital platforms, and a conscious mindset of conflict-sensitive peace promoting environmental resilience of agricultural communities. I urge the following: our esteemed policymakers to consider and ensure the forum's recommendations to be used as reference for any actions taken into legislation and eventually concrete policy action. For the academy to continue conducting policy studies on the topics in the Mindanao Policy Agenda and to share your results with us in this forum in our effort to improve policy making. For everyone here today, to help spread this information and to be a part of the solution. We must remember that Mindanao, as its core, is profiled by the industrious hand of its people. It is our duty as Mindanaoans to make sure these hands are dirty only by the soil of a land that leans toward equitable social justice for all. Thank you for inviting us and considering Minda as one of your partner agencies in Mindanao as we encourage the call to close the gaps mentioned today's forum. We recognize everyone's passion for contributing to a better Mindanao. Let's be united to find this island so much a beautiful place as it always has been. Please allow me to expand my appreciation to the Minda team and to all the different teams of the different organizations and institutions. Miss Melo, Tinete, Kunanan, Sheila, Marlo, KP, Joji, Lady, and the rest of the team of Minda who provided support to this event. Maraming salamat po at mabuhay po tayong lahat. Maayong gabi. Thank you very much.
Salamat, Director Resimilia. Indeed, this has been such a very wonderful learning session. No? Sobrang dami po nating babaunin. No? And I hope that as we turn off our Zoom today, no, before we go, meron muna pala tayong announcements. Kindly flash the screen for some announcements before we go. All right. So, a common question po yung pwede bang kumuha ng copy. So, the link is flash in the screen. You may download it at the PIDS website. Just type on MPRF_presentations. Next. You may also, of course, now we wanted to, as much as possible, because this is a yearly event and the PIDS, the MINDA and its partner institutions and universities would really like to improve on how this very important conversation and this policy forum could be further improved. So kindly also click on the link provided in your screen for the post-event evaluation survey, so that this is a ticket to your certificate of participation. So once you have answered the survey, then the certificate of participation shall be emailed to your respective addresses. So please give us your comment, your feedback on this webinar. Next. All right, I think that's it, no? On behalf of the Philippine Institute for Development Studies, the Mindanao Development Authority, Mindanao State University Iligan Institute of Technology, through its Institute for Peace and Development in Mindanao, we would like to extend our heartfelt gratitude to our very adept speakers and presenters for their comprehensive presentations. Of course, these are researches, these are policy researches that would be very much beneficial, not only for Mindanao, but of course the rest of the country. And indeed, the future starts here in Mindanao. Equally grateful to all the discussants who have also provided additional insights that have provided more meaning to what has been discussed technically, politically, socially, and very much important intellectually. Maraming salamat po. Coming from the university, of course, we are not just knowledge producers of something that could be learned by society, but very much important is that to be able to put this theory into practice and that would resonate to the rest of the world, no? Not only in our society. So maraming salamat po. We stay healthy and safe, everyone. At sa muli nating pakikita for the next year's Mindanao Policy Research Forum. This has been your host and moderator. A privilege to host this very important conversation, Yasmira Moner. Lagging off, thank you so much and stay safe, everyone. Happy holidays for our Iliganon friends. Happy Fiesta. Thank you.
Syudad sa ilihan, mga suway nagpasikat sa kasaysayan, mga Kristiyano, Muslimo, gigaunon, nagkahimamatalang sa mga ani, ilihanon, taga-bukid, taga-patag, taga-baybay, magkahiusa kita, kasi karbo, mga bahandi sa kulturang pinayahan,
Recording stop.
sa kalambuan. Kalamidad, pandemya, ugo kaniadtong dekadang